Hi everyone, very good evening to each one of you. Myself, Dr. Vaibhav Jain, and today we are going to discuss about the forensic, right? Some important questions from forensic we are going to see over here, right? What are the things we are having? Let's start it off with the question number one, right? In front of you, you are having the question: a 17-year-old boy is there, right? A 17-year-old boy is there. He is presented to OPD with the pain in anal region. This particular person is having pain in the anal region, right? On further examination, the swab from the anal area is taken and it shows yellow needle crystals. What kind of crystals you are having? Yellow needle crystals. They are always fond of asking this type of questions, right? And these crystals you will be seeing with the picric acid. Picric acid. What is the probable diagnostic test you are going to use over here? Yes. Okay, great. Give me your inputs. What is the test that you are going to have over here? So what is your diagnosis first? What is your diagnosis? So in this case, the diagnosis will be this particular person is having what? ये एक बच्चा है, इसको क्या हो रहा है? Sexual. It is a case of sexual perversion. Sexual perversion. It is a case of sexual perversion, right? Next thing, what is this kind of a sexual perversion? This particular person is having problem with the anal canal. That means he must be having some kind of sodomy, right? Sodomy means anal canal sex. That is going to be your sodomy, right? It would be, maybe it would be a case of, because he is a kid, he is a 17-year-old kid. That means there will be, maybe it can be a case of pedophilia, right? It can be a case of sodomy means anal sex, right? And it can be a case of pedophilia. And what do we call the child of pedophilia? What do we call that particular child? Remember, the child is known as catamite. The child is known as catamite, right? So what are different stains we are having, like Tickman, what is Barbados, what is Takayama, what is Florence? Let's try to understand one by one. So first one in the list we are having is this particular thing. What is this particular thing you are having? So these are the stains test for the blood analysis, right? So first one we are having in the list is your pink feathery thing will be there. Look here, this is the Takayama testing. So when you are going to have this pink feathery thing, that is going to be Takayama. And what we are going to see over here, this is going to be your hemochromosome. Hemochromosomes will be there, and this test is going to have what? Pink feathery thing will be there, right? Whereas, can you appreciate, these are your rhombic crystals. These are going to be your rhombic crystals. When you find rhombic crystals, this is going to be your Tickman test. That is going to be your Tickman test. It is because of Hamin. And we are going to have what kind of crystals? You will be having brown rhombic crystals, beta. We are going to have brown rhombic crystals. That is going to be in the favor of Tickman. तो दो चीजें याद हो गई, एक टाकायामा, दूसरा टिकमन. दोनों किसके लिए हैं? ब्लड के लिए. Third thing that they have asked us in the question, these are your yellow needle crystals. These are your yellow needle shaped crystals, and the test we are going to do for this is going to be your Barberio's test, right? And this test, Barberio's test, is going to be for the spermine. This is going to be for the spermine. किसको आइडेंटिफाई करेंगे? स्पर्मीन को आइडेंटिफाई करेंगे, राइट? इन द सीमन वी आर गोइंग टू हैव व्हाट? स्पर्मीन, राइट? तो उन स्पर्मीन को आइडेंटिफिकेशन के लिए वी आर हैविंग दिस पर्टिकुलर थिंग, राइट? सो दीज आर द टेस्ट फॉर सीमन एनालिसिस के लिए दो टेस्ट याद रखने हैं. फर्स्ट वन इज बारबीरियोस, एंड व्हाट इज दिस पर्टिकुलर टेस्ट? दिस इज गोइंग टू बी योर फ्लोरेंस. दिस इज गोइंग टू बी योर व्हाट इज द स्टेन वी आर गोइंग टू यूज हियर? दिस इज गोइंग टू बी योर फ्लोरेंस स्टेन. और किसके लिए करेंगे दिस टेस्ट? वी आर गोइंग टू डू फॉर choline. We are going to do for choline. And remember, here also you will be finding that brown rhombic crystals. Here also you will be finding brown rhombic crystals. तो brown rhombic crystals दो जगह मिलेंगे. One is your semen analysis, one is your blood analysis. Semen में कहाँ मिलेगा? That is going to be Florence for the choline, right? And Tickman में that is going to be for the hamine. That is going to be for the hamine. So in this particular case, what kind of crystals we are having? These are going to be your yellow needle crystal. Very, very suggestive of what? It is going to be suggestive of what? Which test we are going to do is your Barberio's test. Barberio's test, right? अगर टिकमन के बारे में बात करते हैं तो कौन से क्रिस्टल मिलते? वी आर गोइंग टू हैव ब्राउन रोम्बिक क्रिस्टल्स, whereas in Florence also we are going to have brown rhombic crystals, right? Takayama will be pink feathery, and here we are going to check for spermine, and that is going to be SP, right? So that is going to be the thing, right? Spermine, right? So first question done. Now next question we are having: a 29-year-old female went to the forest. This particular female is going to the forest for some kind of fun activities, right? क्या करने जा रही है पता नहीं, right? And suddenly she had a bite on his leg. उसको एक leg पे bite हुआ. She had a bite on his leg, on her leg, sorry. Okay, she is not able to see, but it is painful. The bite is painful, and now she is having excessive bleeding. अभी क्या हो रहा है उसको? Excessive bleeding हो रही है, right? She is having excessive bleeding. जंगल में तो कुछ भी. So the drug of choice in scorpion bite is going to be what? Drug of choice in scorpion bite is going to be what? In a scorpion bite, you know what is going to happen? Patient is not going to die. Look here, it's done. Okay, so patient is going to die because of what? Patient is not going to die. Basically, patient is having problem. The problem is what? Hypertension is the main problem, right? Hypertension is the main problem. जो जहर चढ़ रहा है, बिच्छू का जहर चढ़ जाता है, that is nothing but your hypertension. And to treat that hypertension, we are going to use the drug is going to be your prazosin is the drug. So basically बिच्छू के काटने के बाद में, scorpion bite के बाद में, what is going to happen? You will be having excess of autonomic storm, and you will be having what? Hypertension. So sir, hypertension like something is not there, right? What we need to see here, this is going to be your king cobra. Next we are having is king cobra, and what kind of a toxin this king cobra is going to produce? Remember, it is going to be a neurotoxin. It is going to be a neurotoxin, whereas V for viper is going to produce it is a vasculotoxic thing. Vasculotoxic means hemotoxic, यानी ये blood के लिए toxicity produce करेगा, and this is the one which is going to produce what? It is the one which is going to do what? Excessive bleeding. अगर किसी को सांप काट जाता है तो what is the strategy? What are the do's? What are the don'ts? Remember, do's are your right means what? First thing you need to reassure. Okay, उसको बोलना है ज़्यादा don't panic, right? Don't need to do anything. Reassure the patient, first thing. सेकेंड थिंग, आई फॉर इमोबलाइज द पेशेंट. उसको लेके भागना नहीं है, उसको बोलना नहीं है भागने के लिए. इमोबलाइज द पेशेंट. जी फॉर गेट टू द हॉस्पिटल, राइट. एच फॉर heart level should be below the, okay, you should be keeping your limbs, H for, just remember, keeping your limbs below the heart level, okay, तो पैरों को नीचे रखना है. Okay, and T for try to identify the snake, try to identify the features of the snake. Okay, and T for also tell the symptoms to the doctor, right? That is going to be the right approach. What are the don'ts? जो जहां पर भी snake bite है वहां से अपन को suck नहीं करना है, right? We need not to put any tourniquet. Don'ts, remember don'ts, राइट. टॉर्निके नहीं लगाना, जहर को चूस के बाहर नहीं निकालना, सकिंग नहीं करना, राइट. वी नीड नॉट टू यूज एनी कोल्ड प्रेसिंग्स, ओके, एनी एल्कोहल, एनी कॉफी, Okay, these things we should not do. Even we should not do the snake catching also. ऐसा नहीं है सांप को पकड़ने चले गए, right? Snake catching भी नहीं करना. These are the don'ts, remember these, right? So these are the things we are going to do, and viper is going to be the answer. Viper is going to be the answer because it is going to be vasculotoxic, right? How you will understand them, right? The first one that we are having is the king cobra. We are going to have is going to be your cobra. Cobra का दूसरा नाम क्या होता है? It is also known as naja naja. Naja naja, right? Naja naja. This is going to be your common carrot. This is your common carrot. Common carrot, right? This is your Russell viper. Russell viper. And this was the question they have asked you. These are your sea snakes. These are your sea snakes. These are your sea snakes, right? So what are the important things about all of them? Let's try to discuss. The sea snake is going to be myotoxic. Okay, this snake is going to be myotoxic. It is going to be toxic for the muscle, right? What it is going to do, it is going to produce rhabdomyolysis. Okay, it is going to produce rhabdomyolysis. Whereas this Russell viper, we have already discussed viper. For viper, it is going to be vasculotoxic. It is going to be vesiculotoxic. It is going to be hemotoxic. It is going to cause what? Hemolysis. It can even produce your DIC. Okay, disseminated intravascular coagulopathy. DIC it can also cause, right? For about this cobra and this common carrot is also known as Bangarus. Bangarus is another name for common carrot. For both of them, they both are coming from the family Elapidae. Elapidae family, and both of them are going to be neurotoxic. Both of them are going to be neurotoxic. Okay, they are going to be neurotoxic. What you need to remember here, for the treatment of all the snake, you need not to go to any baba, right? What you need to do, most of the snakes are non-poisonous, but some are poisonous. What are these poisonous snakes that we are discussing, right? We are having anti-snake venom in the India. It is formed by Hopkins Institute in the Mumbai, right? We are having that anti-snake venom, and it is going to be effective against all these spores, right? One more is there, that is going to be saw-scaled viper. That is also poisonous, right? For that also we are having this anti-snake venom we can use, right? Apart from that, sometimes they will ask you a question, what is the other treatment we are having? So we can use neostigmine. We can use neostigmine plus atropine in the cases of neurotoxic only, right? We can use neostigmine plus atropine in the cases of cobra or common carrot, more likely in the cases of cobra, right? What is the other treatment we are going to have for all others? For all others, we are going to give what? Anti-snake venom. Remember, this anti-snake venom is present everywhere. At every like CHC, PHC, you will be finding this anti-snake venom, right? We are having this polyvalent anti-snake venom. Polyvalent anti-snake venom, right? And it should be given in how much time? That is, it should be given within 4 hours. 4 hours. कितनी vials use में लेते हैं? We are going to use 10 vials, right? So that is going to be the treatment for the snake bite. You need not to take people to some babas. लोग क्या करते हैं? बाबा के पास ले जाते हैं. What they will be doing? अगर इन चारों में से किसी ने काटा, अगर इन चारों में से किसी ने काटा है, the person is going to die. Apart from that, अगर किसी और snake ने काटा है, that is going to be non-toxic, that is going to be non-toxic, right? So what will happen? Person मरेगा ही नहीं, अपने आप ठीक हो जाएगा. So you have to remember, इनमें से कोई भी हो सकता है. Some people will die because of this, right? So you have to take care of this particular thing. Viper is going to be the answer here because they are talking about the excessive bleeding. They are talking about the excessive bleeding is there, right? So that is going to be the answer. Next question we are having, a 46-year-old male patient is died because of some respiratory illness. This patient is having some kind of a respiratory illness which is highly infectious. The illness is going to be highly infectious. Okay, beta. Now this patient is now this person is brought for the postmortem. This person is brought for the postmortem. Which of the following method we are going to use in this particular case? तो postmortem के लिए कौन सा method यहाँ पर use में लेंगे? First technique beta we are having is known as Ghon's technique. Ghon's technique is going to be your en-bloc technique. It is going to be en-bloc technique, where we are going to do what? We are going to take organ blocks, right? यहाँ पर क्या करेंगे? जैसे thoracic ले लिया या abdominal region ले लिया, we are going to divide the complete body into three parts. We are going to divide it into three parts. So एक thoracic segment ले लिया, एक abdominal segment ले लिया, एक pelvic segment ले लिया, right? So this is how we are going to divide in the blocking system. Organ block will be there, and here we are going to do the organ system dissection, right? Dissection will be there. So that is going to be your Ghon's technique. Virtue, you can remember V for virtue, V for one by one. So here we are going to take out each and every organ one by one. That is going to be the virtue technique. This letule is going to be the en masse method. En masse मतलब पूरा एक साथ में ही निकाल लिया. That is going to be all together. This is going to be all together. Okay, remember when we are removing via letule method, the anatomical relation is going to be preserved. So here anatomical relations are going to be preserved. Relations are going to be preserved. Whereas when we are going to do the one by one method, virtue में क्या होगा? Anatomical relation not preserved. Anatomical relations are not preserved. याद रखना है ये, not preserved, right? And most important that we are also doing in the COVID-19. अगर कोई भी infectious disease है, कोई भी infectious disease है, so the method that we are using is known as Rokitansky method, and this is a in situ dissection method. In situ dissection method. ये कब करना है? When we are going to do this, whenever we are having any highly infectious disease, right? So for highly infectious disease, for highly infectious diseases, like we were doing this particular thing in the COVID-19, maybe the patient is of HIV or hepatitis B patient, right? So अगर कोई ऐसा patient है, so we are going to do what? Rokitansky. तो गॉन में क्या करना है? एक particular thoracic segment ले लिया, abdominal segment ले लिया, pelvic segment ले लिया. Letule में it is going to be en masse, that means all organs are going to be together. It is going to preserve the anatomical relations, right? Virtue one by one, every organ is V for virtue, V for one by one, you can remember like that. And Rokitansky is going to be for the highly infectious things, right? So in this particular case, highly infectious is given. So your answer in this case will be what? Your answer in this case is going to be your Rokitansky method. What is the method we are going to use? That is going to be your Rokitansky method. Right? Now try to solve this particular question. A 28-year-old male patient. Patient का क्या हुआ? Person है, he is having a breakup, right, with his girlfriend, and now he has taken 20 tablets of aspirin. ये मरना चाहता है, right? He want to die and he is taking 20 tablets of aspirin to commit suicide, right? To commit suicide. His family brought him to the emergency. What should be done to manage this particular patient? इसको कैसे बचाओगे? Right? What you are going to give? You are going to give N-acetylcysteine or flumazenil or gastric lavage or naloxone. What you are going to give? What you are going to do in this particular case? Try to answer. Dr. Migraine is saying A. Rituraj D. Okay, look here. देखो, what is the thing? Okay, let me do one thing. Let me write all the important things that you should be knowing. The antidotes, right? So first of all, let's start from here. N-acetylcysteine is the antidote for what? N-acetylcysteine is the antidote for what? It is the antidote for PCM टॉक्सिसिटी. पैरासीटामोल की अगर टॉक्सिसिटी हो जाती है, वैसे तो बहुत ब्रॉड रेंज है, राइट? 4 ग्राम तक भी दे सकते हो, राइट? बट इफ समवन इज हैविंग टॉक्सिसिटी ऑफ PCM, यू विल बी गिविंग N-acetylcysteine, which is a mucolytic drug, right? Mucolytic भी N-acetylcysteine. What is this flumazenil? Flumazenil is going to be the drug we are going to use for what? Benzodiazepine poisoning. Benzodiazepine ये क्या करता है? Fulmazenil, राइट? दैट इज हाउ वी कैन रिमेंबर. तो ये सारे मज़ों को ख़राब कर देता है. बेंजोडाइजेपिन अगर किसी ने ज़्यादा ले लिया, बेंजोडाइजेपिन्स आर गाबा माइमेटिक ड्रग्स, और they are going to do what? Basically they are GABA facilitatory. They are going to increase the GABA. And GABA is a depressing neurotransmitter. So what is going to happen? You will be feeling sleepy, like alprazolam, clonazepam, right? So उसके पूरे मजे खराब कर देगी flumazenil, right? Next drug we are having is going to be your naloxone. Naloxone is the antidote for opioid poisoning. It is the antidote for opioid poisoning. Morphine लेके बंदा आया, we can give naloxone. क्या होगा? बंदा सीधा खड़ा हो जाएगा, राइट? Naloxone और naltrexone we can use. And what is the sodium bicarbonate? It is a base. And with this we are going to do what? Alkalinization of the urine, right? Of urine. So this is the thing we are going to do in this particular case. Gastric lavage तो करनी है. Gastric lavage we are using the evolved tube. We can use the evolved tube and we can do the gastric lavage. यानी पेट में जो भी है उसको तो बाहर निकाल लेंगे. Apart from that we need to give, sometimes we need to give what? Antidote, and this is how we are going to give the antidote. अगर इससे भी काम नहीं हो रहा, we can even do dialysis in this particular patient. We can even go for urine dialysis. Okay, hemodialysis you can remember. तो डायलाइसिस भी कर सकते हैं अगर इससे भी काम नहीं हो रहा, राइट. सो लेट मी मेक अ नोट फॉर ऑल द एंटीडोट्स दैट यू शुड बी रिमेंबरिंग. सो सारे एंटीडोट्स यहीं पर लिख लेते हैं. इफ द पेशेंट इज कमिंग टू यू विद मीथेनॉल पॉइजनिंग, राइट. अगर मीथेनॉल पॉइजनिंग का पेशेंट है, मीथेनॉल पॉइजनिंग, व्हाट वी आर गोइंग टू गिव, वी आर गोइंग टू गिव हिम इथेनॉल. इथेनॉल मतलब C2H5OH, यानी वट एवर ड्रिंक्स यू आर हैविंग, राइट. सो अल्कोहल दे देंगे, ethanol, or you can also use fomeprazole. Fomeprazole is the antidote for ethanol as well as methanol, right. That is going to be the first thing. If I talk about carbon monoxide poisoning, so carbon monoxide poisoning अगर हो जाती है तो क्या करना है, ऑक्सीजन देना है, right. You need to give what? ऑक्सीजन टू द पेशेंट. यू नीड टू गिव ऑक्सीजन टू द पेशेंट. अगर पैरासीटामोल की टॉक्सिसिटी हो जाती है, वी हैव सीन दैट इज गोइंग टू बी एन एसिटाइल सिस्टीन. ओपियोइड के लिए क्या देखा था, opioid poisoning, we will be giving what? Naloxone. Organophosphate poisoning, we have seen organophosphate poisoning के लिए क्या देते हैं हम लोग? Atropine, because everything will be contracted, cholinergic things will be activated, you will be having activation of parasympathetic nervous system. तो क्या करोगे? Anticholinergic दे दोगे, that is going to be your atropine is the drug of choice, right. What about cyanide poisoning? Cyanide poisoning, the best drug that we are having is nothing but your vitamin B12. okay, पहले हम लोग amyl nitrite भी देते थे. sometimes you can have questions with amyl nitrite or sodium thiosulfate, right. This is what we were using earlier. Now the best drug that we are having is going to be your vitamin B12. What about this thallium? Thallium, we are going to use Persian blue, right. And for benzodiazepine, that would be your flumazenil. That is going to be the drug of choice. Flumazenil is going to be the drug of choice. So methanol के लिए fomeprazole है, remember, and benzodiazepine के लिए we are having what? Flumazenil. These are certain antidotes and their poisonings, right. So this is what you need to remember. So in this particular case, we are going to, if we are ruling out, this is going to be for the PCM, this is going to be for the benzodiazepine, and naloxone is going to be for what? Opioid. Naloxone, then we can shift the patient into naltrexone. बाद में क्या कर सकते हैं, उस patient को naltrexone दे सकते हैं. Okay, you understand? Next question we are having is, a child is presented to emergency with the history of ingestion of certain unknown fruit. पेशेंट ने क्या खा लिया, एक बच्चे ने unknown fruit खा लिया. Now he is having issues. What are the issues? Like patient is having blurring of vision, mydriasis is there, blurring of vision, मतलब blurring of vision, mydriasis मतलब the pupils are dilated. If the pupils are dilated, patient is not able to see, right. Patient is having dry mouth. Why this dry mouth is happening? Because this is some kind of a anticholinergic poisoning, right. Inability to pass the urine. I've told you cholinergic, anticholinergic पढ़ाया है, फिजियो में भी पढ़ाया है, फार्मा में भी पढ़ाया है, right. So he will be having problem with the passage of urine because bladder is not contracting, right. He will be having restlessness. What is the antidote? First of all, you need to identify the poisoning. What is the poisoning we are having over here? In this particular case, what is the poisoning they are talking about? So what is going to be your diagnosis in this particular case? Remember, your diagnosis here is going to be some anticholinergic poisoning. कैसे पता चला anticholinergic poisoning है? Sir, cholinergic nervous system is going to contract everything, right. It is going to contract M1, M3, M5, right. I've told you. So M1 contract होगा, M3 contract होगा. What is going to happen? You will be having contraction of pupil. Sir, meiosis is the feature of cholinergic system and mydriasis is the feature of anticholinergic system. So this particular patient is having what? Mydriasis. Okay, urine increased passage of urine is a feature of Cholinergic system, that is what we have seen in the cases of organophosphate poisoning. OPC में क्या होता है, कपड़े गंदे हो जाते हैं, right? I've taught you M1, M3, M5. Last time we can revise M1, M3, M5. So what is going to happen? They are all going to do what? They are GQ subunit. They are going to do what? Contraction. So you will be having contraction of salivary gland. That means more saliva will be coming out. You will be having contraction of urinary bladder. That means urine will be going out, right? So what is going to happen? So this is some kind of anticholinergic poisoning. What others anticholinergic poisoning do you know? So it can be either it can be dhatura poisoning, dhatura, it can be belladonna poisoning, it can be atropine poisoning. Remember, all these three things are going to be working on the same principle. All of them are what? Anticholinergic things, right? And what is the drug of choice for all these things? Drug of choice for anticholinergic poisoning, or drug of choice for dhatura, belladonna, or atropine poisoning? Yes, waiting for your response. What is the drug of choice for dhatura, belladonna, or atropine poisoning? All are not exactly same, but they are having the same principle. They are having the same principle. That means their symptoms will be same. Like whenever we are having any cholinergic poisoning, what is going to happen? The symptom remains same. Okay, symptom remains same. Very good, Rituraj. That is going to be your physostigmine. Drug of choice is going to be physostigmine. It is going to do what? It is going to increase your acetylcholine, right? इसमें क्या, और एंटीकोलिनर्जिक में acetylcholine कम हो गया. Now what we want to do? We want to increase our acetylcholine, and the drug of choice will be physostigmine, right? So this is the drug of choice in this particular case. That is going to be your physostigmine. When we are going to use atropine plus pralidoxim, atropine plus pralidoxim is the drug of choice for organophosphate poisoning. OPC poisoning में use में लेंगे, राइट? ओपीसी में क्या हो रहा है? वी विल बी हैविंग अपोजिट सिम्टम्स. ओपीसी में अपोजिट सिम्टम्स आई टॉट यू इन डिटेल, राइट? वहां से देख लेना अगर कोई भी इशू है तो, राइट? सो ओपीसी पॉइजनिंग वी आर गोइंग टू हैव सर्टेन प्रॉब्लम्स, राइट? एंड टू ट्रीट देम वी नीड टू गिव व्हाट? एंटीकोलिनर्जिक ड्रग. दैट इज गोइंग टू बी atropine. In fact, this atropine I have told you in medicine as well, it is going to be drug of choice for bradycardia with AV block. It is going to be drug of choice for bradycardia with AV block. AV block, right? It is going to do what? Atropine is going to do what? Atropine का function क्या होता है? Atropine is going to increase your SA node. That is going to be increasing your heart rate. It will be increasing conduction, and that is what is happening here, right? Next thing, what is about this digibind? Digibind is going to be what? It is going to be antidote for digoxin. It is going to be antidote for digoxin. And where do we use digoxin? Can anyone tell me what is the most common type of arrhythmia you will be having because of digoxin? Most common type of arrhythmia you are having because of digoxin is going to be your, yes beta, that is going to be your ventricular bigeminy. Ventricular bigeminy. Whereas the most specific type of arrhythmia, if they ask you most specific type of arrhythmia because of this, that is going to be NPAT with AV block. That is going to be non-paroxysmal atrial tachycardia with AV block. And this digoxin we are going to use in the cases of heart failure. Okay, medicine में पढ़ा था परसों. That is what is here, right? So answer in this particular case is going to be physostigmine. Answer here will be physostigmine. Okay. The wounds shown below are suggestive of what kind of injury? The wounds which are shown below are suggestive of what kind of injury? So these are the wounds on the flexural aspect of the arm. यहाँ पर अगर कोई wound है, these are the wounds which are going to be because of what? Are they hesitational cuts? Are they defense wounds? Are they self-inflicted wounds? Or maybe they are the postmortem wounds, right? Try to answer. Okay. You are saying A. Everyone agrees with A. Are they hesitational cuts? Hesitational cuts क्या होते हैं? They are basically suicidal cuts. कोई suicide के लिए try कर रहे हैं. If they are trying to do the suicide, right? They are also known as intentional cuts. Intentional cuts. They are also known as tentative cuts. कुछ भी लिख सकते हैं. Tentative cuts. Right, so these are the cuts we are going to have on the flexor aspect of the arm. यहाँ से generally लोग हाथ काटते हैं, right? इनका मकसद नहीं होता मरना, right? But the thing is they are just trying to cut it off, right? Second thing, where do you find this defense wound? अगर कोई हमला करेगा तो क्या करेंगे? If someone is trying to like use something on you, what you will be doing? You will be डूइंग लाइक दैट, राइट। तो हाथ के ऊपर क्या होगा, इस बार भी कट कौन से सरफेस पे आएंगे, फ्लेक्सर आर सरफेस पे आएंगे, राइट। सो हियर ऑल्सो यू विल बी हैविंग कट्स ऑन द flexor surface. If someone is trying to kill you, like you are facing something like homicide, कोई आपको मारना चाह रहा है तो क्या होगा, you will be having cuts on the flexor surface and these are known as defense wound बोलेंगे इनको, ठीक है। these are seen in the cases of homicides के केस में मिलेगा, right। so they are defense wounds, no they are not defense wounds, right। what about this self inflicted wound, these are seen in like Japanese people, let me give you example, they are doing what, seppuku or harakiri. In that what they will be doing, they will be taking the knife and then they are putting the knife inside, right, that is going to be the self inflicted wound that is going to be seen in the cases of harakiri, also known as seppuku, also known as seppuku or harakiri. They are seen in the Japanese people, they are doing Japanese people used to do this thing, right, that is known as harakiri. And what is this postmortem wounds, they are going to be, that means these are the wounds which are occurring after the death of the person, right. so these are the wounds after the death of the person, so they are going to be the post-mortem wounds. So in this particular case, can you appreciate this particular case, she is trying, maybe she or he is trying to cut the hand, right, and that is going to be the hesitational cuts, that is going to be the hesitational cuts, all of you are right. Okay, next question we are having, a 29-year-old drug addict patient is presented to you. On examination, he is having black staining of the tongue, right, and also teeth are also getting black, right, and ulceration of nasal septum was there, which of the following is not a feature of this drug toxicity, कौन सा इसका feature नहीं है, which of the following is the feature, which of the following is going to be not a feature of this particular toxicity. So what is your diagnosis, what is the toxicity they are talking about, diagnosis, what is the diagnosis we are going to have over here, the diagnosis in this particular case is going to be what, it is going to be cocaine. Remember, cocaine will be having all these things. Cocaine is going to be cocaine is a thing which is going to produce what, vasoconstriction. Yes, it is going to produce vasoconstriction, and whenever there will be vasoconstriction, there will be hypertension also, there will be decreased vessels will be vasoconstricted, so there will be decreased blood supply, right. what is going to happen, this blood vessel is high likely to undergo necrosis, right, this thing can happen. So that is going to cause what, that is going to cause perforation of the septum as well, perforation of the septum can be seen. Those people who are snorting or sniffing the cocaine, what can happen, this is a vasoconstrictor drug, it can cause nasal septal perforation also, right, it can cause jet black pigmentation of the tongues and teeth as well, right. So these are the things. What are the signs of this particular thing, what are the signs of the cocaine poisoning, cocaine overdose का sign क्या होगा. So patient will be having what, always remember, patient will be euphoric, patient euphoria में रहेगा, right. Patient will be having what, it is going to be thing which is going to increase your BP, increase your BP means it is a vasoconstrictor drug, so it is going to cause what, anxiety, the symptoms will be anxiety. You can also have sometimes Magnan phenomena along with that, right. What will happen to eyes, you will be having mydriasis, remember mydriasis, meiosis you will be finding in the cases of OP poisoning, organophosphate poisoning, right. Here you will be having what, mydriasis, again you will also find meiosis in the cases of opium, right. Next thing, you will be having what, you will be having tremors in the muscle. Basically tremors are the muscle tremors, right. Basically you will be finding the tremors, along with that you can also have diphoresis, you can also have diphoresis, right. So all these things will be present, right. Which of the following is not a feature here, okay. So do you find hyperthermia, yes, we can have hyperthermia because of high circulation. This patient will be euphoric, yes, this patient will be euphoric, right. Mydriasis is also going to be present. Remember, it is not going to show bradycardia, in fact it is going to show what, tachycardia, because it is a hypertensive kind of thing, right. So it is going to show tachycardia in this question. The odd one out is going to be your bradycardia, right? So A will be the answer here. A will be the answer here. Now the next question we are having: a 32-year-old female give birth to twin child, but the husband believe that she is having affair, right? क्या हुआ? We are having a 32-year-old female, she is giving birth to the child. इसके बच्चे हुए, कितने बच्चे हुए? दो बच्चे हुए, right? But the husband believe that she is having affair. Husband को लगता है she is having affair with someone, right? And this child does not belong to him. और उसको लगता है these are not the child of him, right? So he went for the DNA testing. He went for the DNA testing, and what he find out on the DNA testing, that one of the twins, one of the baby is not belong to him, right? एक बच्चा किसी और का है, एक बच्चा इसका है. What is this particular phenomena is known as? This particular phenomena is known as, is it superfetation, is it superfecundation, is it posthumous child, or is it supposititious child? What is the phenomena that we are discussing over here? So what is the superfetation? Remember, superfetation is going to have how many T? Superfetation में कितने T आ रहे हैं? दो T आ रहे हैं, right? So what is going to happen? The fertilization is happening. Remember, the fertilization is happening in different, in two, you can remember, like different or two menstrual cycle, टू और डिफरेंट मेंस्ट्रुअल साइकिल. यहाँ पर दो टी आ रहा है, याद रखना है, दो साइकिल आ रही है. यू कैन रिमेंबर लाइक दैट, टू टी इज गोइंग टू बी फॉर द टू साइकिल. और ये किस में देखने को मिलता है? जनरली दिस थिंग इज सीन इन द केसेस ऑफ लाइक कैटल्स, इन द डॉग्स, ऑल दिस थिंग्स विल बी सीन, राइट? इसीलिए एक साथ में क्या होता है, बहुत सारे बच्चे होते हैं, राइट? सो दैट इज गोइंग टू बी सीन इन द केसेस ऑफ कैटल्स मोर कॉमनली, राइट? What is the superfecundation? Superfecundation मतलब साइकिल कितनी है? साइकिल इज गोइंग टू बी one. Superfecundation is going to have one cycle. So in one menstruation cycle there will be two ovum will be fused, right? So what is going to happen? So here you will be having fertilization of two or more ova in single cycle, in the same cycle, single cycle, by separate act of coitus or separate sex, right? By separate act of intercourse. मतलब it can be with the same person, it can be with the different person. Okay, so here you can have different partner. यानी एक ही साइकिल में क्या हुआ? एक ही साइकिल में दो लोगों ने सेक्स किया. नाउ दिस पर्टिकुलर पर्सन इज हैविंग टू टाइम्स फर्टिलाइजेशन. एक बेबी किसका है, दूसरा बेबी किसी और का है. दिस इज नॉन एज सुपर फिकंडेशन. इट इज रेयर, इट इज नॉट वेरी कॉमन, राइट? बट दिस थिंग कैन हैपन, राइट? सो दिस इज योर सुपर फिकंडेशन, राइट? नेक्स्ट इज योर पोस्ट ह्यूमस चाइल्ड. व्हाट इज दिस पोस्ट ह्यूमस चाइल्ड? पोस्ट ह्यूमस चाइल्ड मतलब the baby is born after the death of the father, right? So baby born after the death of father, this is known as posthumous child. बाप के मरने के बाद में जो बच्चा पैदा होता है, that is going to be posthumous child, right? And what is this supposititious child? This is also known as fictitious. This is also known as fictitious. Sometimes we call it substituted also. तो ये monetary benefits के लिए होता है, substituted. Okay, this is for the monetary benefit. Some people are substituting the child. That is going to be for the you can remember, for the money, right? For the blackmailing someone. This type of child is known as supposititious or fictitious child, right? So these are the things you need to remember about it, right? Next question we are having is about the paraphilias. A newly married couple is shifted to a new apartment. किसी की शादी हुई है, they are shifting to a new apartment, right? And the female noticed that her clothes, उसके कपड़े that she left for drying are missing. जो कपड़े उसने सुखाए थे, they are missing. And on one day she finds out एक लड़का उसके कपड़े ले जाता है. The boy is taking away her clothes and he is using that particular clothes for the sexual gratification, right? What kind of paraphilias we are having here? What is this paraphilia? Paraphilia matlab sexual problems. These are going to be the paraphilias, right? So what is the paraphilia we are going to have here? what is the meaning of masochism, what is fetishism, what is voyeurism, what is protourism, क्या होती है सब चीज़ें, right? So let's try to understand what is this masochism. मैसोचिज्म का एक काउंटर पार्ट होता है दैट इज नोन एज सैडिज्म. सैडिज्म में क्या होता है, दर्द देने में मजा आता है, मैसोचिज्म में दर्द लेने में मजा आता है, राइट? सो दैट इज गोइंग टू बी दिस पर्टिकुलर पर्सन इज गोइंग टू टेक द पेन फॉर sexual gratification. If a person is taking the pain for sexual gratification, इसको दर्द सहने में मजा आता है, that is going to be your masochism. masochism बोलेंगे. sadistic और sadism is what, यानी जो person pain देता है, that is going to be the sadistic or sadism, right? What is fetishism? fetishism का मतलब क्या होता है, when a person is using inanimate objects like the undergarments of the female, these things if someone is using for the sexual gratification, this is known as fetishism, right? So here the person is using the clothes of females, clothes, or you can remember inanimate objects of the females for sexual gratification. This is known as what, fetishism. This is known as what, fetishism. इसको क्या बोलेंगे, fetishism, right? voyeurism का मतलब क्या होता है, voyeurism का मतलब क्या होता है, to see someone, किसी को देखना, right? to see someone performing certain acts, like if there is a female, she is changing their clothes, right? उसको देख रहे हो, right? if there is a couple who is doing intercourse and you are looking at it, right, you will be voyeurism, right? You will be doing what, voyeurism, also known as peeping tom, also known as scatophilia, right? So that is going to be to see someone changing their clothes, maybe bathing, maybe doing intercourse, right? So that is going to be the voyeurism, also known as peeping tom. इसी को क्या बोलते हैं बेटा, peeping tom और scatophilia. peeping tom और scatophilia, right? इसमें डायरेक्ट जेल होती है, राइट? नेक्स्ट वी आर हैविंग इज फ्रोटूरिज्म का मतलब क्या होता है, हियर द पर्सन इज गोइंग टू रब, यू कैन रिमेंबर फ्रोटूरिज्म में आर आता है, सो दिस पर्सन इज गोइंग टू रब द बॉडी पार्ट्स, राइट? rubbing the body parts, right? These people you will be finding in the trains, in buses, right? So they are going to rub the body parts against the thighs of the female, or they may be touching the breast of the female. That is going to be the frotourism. Right? तो ये sexual gratification कैसे लेते हैं? They are going to touch the organ of the another sex, right? That is going to be the frotourism. Next we are having is one more thing is there, transvestism का मतलब क्या होता है? Trans मतलब opposite, right? So these are the people who are going to wear the dresses of the female, right? So they are going to wear the clothes of opposite sex, opposite sex के कपड़े पहन के ये sexual gratification लेंगे. So that is going to be wearing the clothes of the opposite sex, that is going to be your transvestism. समझ में आ रहा है? What is transvestism? Transvestism का एक और नाम है, that is known as eonism. Eonism, right? There are some females, they are wearing the clothes of the male, right? There are some males who are using the clothes of female for the sexual gratification. That is going to be, if they are wearing, that is known as transvestism. If they are using it for some other purpose, that is going to be your fetishism. Right? This is masochism, मतलब दर्द लेने वाला. So what is going to be the person who is going to give the pain? That is known as sadism. Okay, make a note. That is going to be sadistic person. Sadism का मतलब क्या होता है? This is the person who is going to give the pain. So इनको कैसे मजा आता है? इनको मजा आता है पेन देने में. They are going to give the pain. They are the pain givers. They are going to give the pain. They are going to slap, right? And they are going to give the pain for gratification. Same gratification. That is going to be sadism. That is going to be sadism. और अगर एक बंदा मैसोचिज्म वाला है, दूसरा sadism वाला है, एक को दर्द देने में मजा आ रहा है, एक को दर्द लेने में मजा आ रहा है, तो इनका क्या बन जाता है? दैट इज नोन एज बॉन्डेज. अगर ऐसा कोई कपल है, दैट इज गोइंग टू बी बॉन्डेज. सो यू विल बी हैविंग सैडिज्म plus masochism. Sadism plus masochism is going to make what? They are going to make bondage, right? You must have heard about certain other things like lust murder. What is that lust murder? So these are the people who are getting the cue. They are getting the cue. They are getting the urge after killing the partner, right? So these are the people. Here the murder will lead to cue for sexual gratification. इसके बाद में सेक्स करेंगे, पहले मर्डर करेंगे, राइट? सो देन दे विल बी डूइंग व्हाट? necrophilia, then they will be doing the sex, right? That is going to be the lust murder. Some people are having undunism. What is this undunism? Undunism, remember, undue means it is going to have, this person is going to have urophilia. Urophilia matlab urophilia, euro matlab urine. So they are going to have love for urine for sexual gratification. That is going to be your urophilia. But don't confuse it with the another term that is going to be uranism. Uranism का मतलब क्या होता है? These people are doing things like, they are doing things like fingering. They are doing things like fingering or licking or sucking of the genitalia of the another person, genitalia of partner. That is known as uranism. So don't confuse uranism and undunism. Both of the things are different. Undunism में क्या होगा? He has the love for urine. Uranism, he will be doing fingering, licking, all those things he will be doing, right? That is going to be uranism. That is going to be uranism. What is going to be the next thing? Exhibitionism. Exhibition. Here the person is going to show the organs to public, right? Here the person is going to show the organs to the public, showing the organs to the public. Organs means private part. Organ means private part to public, in public place. This is going to be showing off in the public. That is going to be a exhibitionism, right? What is necrophagia? What is going to be necrophagia? Necrophagia का मतलब क्या होता है? Dead body को खाने वाले. These people are going to eat what? They are going to eat the dead body. Dead body. They are going to eat what? Dead body for sexual gratification. Lots of movies we are having. You must have seen such movies जहाँ पर क्या होता है? Dead body को खाने से they will be having the sexual gratification. Sometimes they are also doing they are also having the trait of necrophilia. Necrophilia मतलब क्या है? They are doing the sex with the dead, right? So they are going to do the sex with the dead bodies. Sex with the dead body. That is going to be the necrophilia. Necrophilia, right? So these are certain terms you have to remember. Some more are there. They are important, so we can remember. Like we are having coprolalia. Coprolalia का मतलब क्या होता है? Using the obscene language, गंदी बातें करना. That is going to be using obscene language for sexual gratification. Obscene language, गंदी बातें करना, गालियाँ देना. That is going to be coprolalia. Coprolalia. What is partialism? Partialism का मतलब क्या होता है? These are the people who are going to have special interest apart from the sexual organ, right? So these are the people who are going to have sexual interest with other body parts. Sexual interest with other body parts apart from genitalia. Like some people are having a habit of licking the armpit. That is going to be your partialism. Okay. What is this? Clismaphilia. This is your PYQ. Clismaphilia. They are going to use what? They are going to use enema. They are going to use enema for sexual gratification. That is going to be clismaphilia. Clismaphilia. Okay. If the female is having more excessive sexual desire, what do we call it? And if the male is having excessive sexual desire, what do we call it? अगर मेल्स के अंदर एक्सेसिव सेक्सुअल डिजायर है, वी कॉल इट व्हाट, वी कॉल इट satyriasis. Satyriasis means excessive sexual desire. Excessive sexual desire in males is known as satyriasis. If excessive sexual desire in females, we call it nymphomaniac. We call it what, beta? Nymphomaniac. Nymphomaniac. Nymphomaniac are the females, they are having excessive sexual desire. Excessive sexual desire. Okay, excessive sexual desire in females is known as nymphomaniac. In males is known as what? Satyriasis. Okay, next we are having diplodism. दो तीन और लिख लेते हैं. Diplodism. Here the teacher will beat the student. The teacher will beat the student to gain the sexual gratification. यहाँ पर क्या होगा? Teacher is going to beat the student. Teacher is going to beat the student, right? Then we are having that like pedophilia we are having, as well as we are also having the gerontophilia. Geronto मतलब क्या हो गया? Gerontophilia, बड़ों के लिए प्यार. That is going to be gerontophilia. Here the person is going to do sex with the older person, and this is a normal thing, so that is going to happen. This is going to be gerontophilia. मतलब gerontophilia में the sex will be done with the older person, right? And lastly you can remember the masturbation. This is also known as onanism. This is also known as onanism, basically masturbation, right? So these are the some paraphilias that we are having. We are having a question from paraphilias, they are always asking, right? So we are having masochism, fetishism, voyeurism, frotteurism. Masochism मतलब sadistic pleasure लेने वाला, right? The person who is going to inflict the pain, right? Fetishism, inanimate object. Voyeurism, peeping tom, right? Scatophilia, peeping tom, right? Frotteurism means to rub the body part against the thighs or buttocks of the female, or maybe breast, right? So that is going to be frotteurism. Transvestism मतलब कपड़े दूसरे के पहनना. Sadism is going to be पेन देने वाला. Bondage मतलब sadistic plus masochism दोनों. Lust murder, they will be killing the person for sexual gratification. Undunism with the urine. Uranism with the fingering, licking genitalia, right? Exhibitionism, that is going to be for the showing the private parts. Necrophagia मतलब eating the dead, and necrophilia मतलब sex with the dead, right? Coprolalia मतलब गंदी बातें, right? Partialism for the another body part apart from genitals. Klysma मतलब enema. Satyriasis, males में excessive desire. Nymphomaniac, females में excessive desire. Diplodism, teacher बच्चे को मार रहा है. And gerontophilia, love for the elder people, right? And masturbation, this is your paraphilias. Great. Okay, now the next question they are asking is on the MTP. What is this medical termination of pregnancy? So a 23-year-old female has got pregnant after intercourse, right? She has got pregnant with the boyfriend, right? They were using the contraceptive methods. But maybe it failed, but it goes failed, and she is 23 weeks pregnant now, right? Coming to the hospital for medical termination of pregnancy due to failure of contraceptive, right? Failure of contraceptive is a thing we can do termination of the pregnancy, right? Which statement is correct here? One doctor opinion is sufficient. Medical board opinion should be taken. Two doctor opinion is going to be sufficient, or MTP should not be done in this particular case, right? Try to answer. So what is this MTP Act? The MTP Act that we are having, MTP 1971 Act, and now we are having the amendment, that is going to be the advancement we are having in the 2021, right? So what are the points that you have to remember, right? What is the indication? Earlier it was limited to the only married woman. Now it is also for the unmarried woman also, right? Now you have to remember this particular part, right? Second thing, what is the age limit? Gestational age limit कब तक करवा सकते हैं? So 24 week for the rape survivor. If the patient, if the person is having rape, maybe this person can be a incest person, can have incest within the family, or she is a minor. In this particular case, we can have abortions. Right? Beyond 24 weeks for substantial fetal abnormalities. अगर बच्चे को कोई अच्छी खासी बीमारी है, then we can go for abortion even after 24 weeks. Okay, कितने डॉक्टर होने चाहिए? Now it was till 20th week one registered medical practitioner, RMP will be enough. 20 के बाद में you need to have how many doctors? That is going to be two doctors should be there, right? Medical board approval after 24 weeks. अगर किसी को abortion कराना है after 24 weeks, that is going to be requiring what? Medical board approval, right? You can have fine or imprisonment of 1 year if you are not following these things. If you are just breaching the women's confidentiality, अगर उसको breach करते हो, then you will be doing what? You will be having the fine of this particular thing, right? So what is this for the contraceptive failure? For the contraceptive failure, remember, we can have abortion, we can have better say MTP, we can have up to 20 weeks. For contraceptive failure, we can have up to 20 weeks. And who is going to do the MTP? What is the requirement for MTP? After clearing your FMG exams, you cannot directly do the MTP, right? You need to have at least, the RMP should have done at least 25 MTPs. They have assisted 25 MTPs with some other doctors, some gynecologists, if they have assisted approximately 25 MTPs, right? Apart from that, they should be having at least 6 months of house job or residency on OBGY, or maybe they can have 1 year experience with the OBGY doctor, right? So that is the person who is going to do this MTP. So now in our case, yes, everyone is right, that is going to be MTP should not be done. It should not be done beyond 20 weeks, right? Because it is a case of contraceptive failure, right? Now next question we are having, identify the plant that is shown below. You are not able to see it, right? Let me write it for you. This is the yellow oleander. Here the plant that we are having is your yellow oleander, right? This is also known as Cerebra thibacea. This is also known as Cerebra thibacea. Yellow तो दिख रहा होगा. Green color you are not able to see, right? Green screen की वजह से. So this is going to be yellow oleander. Let's try to understand what are other plants we are having. We are having plants like aconite. This is your aconite. Also known as, what are the other name for this aconite? You can remember, it can do what? Hippus. That means here you can have what? Alternate contraction and dilatation of pupil. Here you can have alternate contraction and dilatation of pupil. And if they ask you what is the most dangerous part, what is the most poisonous part of this particular plant, that is going to be the roots. Remember, roots are the most toxic thing. Most toxic thing here is going to be your roots, right? And what do we call it? We call it meetha zahar, or we also call it monk's hood, right? That is going to be your aconite. This is the image of Dhatura alba. Alba means white, that is going to be Dhatura. And this is the image of thorn apple. What is the active principle? They have asked you question, what is the active principle in Dhatura? The active principle is going to be what? It is going to be atropine plus hyoscine. atropine, or you can remember hyoscine. Both of them are what? Anticholinergic things, right? These are the datura is also known as, it is the most common roadside poison, right? Railway track में these people are using what? ये crush करके seeds निकालते हैं, they are mixing it with the sweets and then they are giving to you, right? You are eating that fruit and what is going to happen? They will be asking you, your cognition will be down because it is the anticholinergic thing. सिंपैथेटिक पैरासिम्पैथेटिक में पढ़ा है, क्या होगा? M1 कम होगा, you will be having decrease in the cognition, you are not able to identify the person, the person will ask, जो खिलाने वाला है चोर पूछेगा पैसा कहाँ रखा है, you will be telling पैसा वहाँ रखा है, because your cognition is down, right? You are not able to think. Second thing, you will be having mydriasis because it is anticholinergic poison. You will be having mydriasis, you are not able to see the person, तुम thief को देख ही नहीं पाओगे, you are not able to identify him, you will be having blurring of vision, right? So they know about this particular thing, but the question they will ask you is about the fatal dose. What is the fatal dose for this particular thing? That is going to be 100 seeds. What is the fatal dose? That is going to be 100 seeds are going to be the fatal dose, right? What is this particular plant we are having? This is going to be your pink oleander. This is going to be your pink oleander. This is your pink oleander, also known as nerium. This is also known as nerium, right? And this particular plant is the plant for digitalis. ये क्या है? Digitalis. और इससे क्या निकाला था हम लोगों ने? We have extracted the digoxin, and digoxin is a inotrope we are using in the cardiac failure, right? Apart from this, this is the drug we are using in the heart failure cases. We are going to use this particular drug, right? So we are having these things, so the answer here will be yellow oleander. Okay, now next question we are having. A 26-year-old male patient is presented to emergency after a road traffic accident. Same story we have discussed in medicine also. He is also having lucid interval. Okay, there will be a period of consciousness and unconsciousness. Okay, and he's sent for NCCT head after the trauma. NCCT head and some lemon shape or biconvex opacities are noted. You can appreciate the opacities. What could be the possible diagnosis over here? Okay, यहाँ पर diagnosis क्या होगा in this particular case? What is going to be your diagnosis? Your answer in this particular case, we have seen this particular table in the medicine also, if you have attended the class. Otherwise, let me just explain it for you. So how you are going to approach the head trauma, right? So in head trauma, you can have EDH, you can have SDH, you can have subarachnoid, you can have intracerebral, right? So in the cases of EDH, the most common artery that is going to get ruptured is going to be your middle meningeal artery. On appearance on NCCT, you will be having you will be having this lemon or biconvex opacities will be there. This type of opacities you will be finding in the NCCT of EDH. EDH matlab extradural hemorrhage will be there, right? Next thing what you need to know, it is going to be biconvex, right? And here you will be having characteristic thing that is going to be lucid interval. And what is the site from where you are going to get entry? That is going to be pterion, right? And what is the surgery that you are going to do for the treatment? That is going to be your burr hole surgery, right? In the cases of subdural hematoma, matlab dura ke niche agar hematoma, accumulation of fluid is there, what is the thing that is going to get rupture? Most commonly these are going to be your emissary bridging veins. And what is the appearance you will be having? You will be having this banana shape appearance or crescent or half moon shape appearance on the NCCT head. It is the only venous hemorrhage and the drug of choice is going to be your mannitol. You want to decrease the pressure. Okay, next thing we are having subarachnoid hemorrhage. Very characteristic thing is worst headache of my life or thunderclap headache they will be writing you. Okay, here you will be having rupture generally in the berry aneurysm, or maybe sylvian feature. You will be having accumulation of fluid along with the CSF, blood CSF mixed ho jayega, right? And the drug of choice is going to be nimodipine is the drug of choice that you are going to give, right? Here you will be having accumulation of blood in the CSF, blood CSF mix हो जाएगा, that is going to be in the Sylvian fissure or basal cisterns, right? This is going to show you this type of image, right? Lastly, we are having this particular site. This is the site of most common hypertensive bleed, and that is going to be your putamen. Here putamen bleed will be there. Putamen is the site for the most common bleeding, right? This is your intracerebral hemorrhages. Here you can have rupture in lenticulo or striate artery or Charcot artery. Here you will be finding the midline shift. This is your midline shift of the ventricles, you can appreciate, right? Here you will be having what? You will be having most common hypertensive bleed, that is going to be putamen bleed. And the drug of choice will be nicardipine, C for C. You can remember ICH में क्या देना है? Nicardipine. Nimodipine you will be using in the subarachnoid, D for subarachnoid, right? Here last में D आ रहा है तो D याद रख लो, that is going to be subarachnoid, right? So these are the approach to head trauma. So here in the question they are asking from the FMT also, right? So you need to remember how to answer this question, right? Just give me a moment. No issues with this? Okay, so in this particular case, what is going to be your answer? In this particular case, your answer will be EDH. It is going to be lucid interval is given, lemon shape opacities or biconvex opacities will be there. That is going to be in the favor of EDH, extradural hematoma. How you are going to treat? You are going to do burr hole surgery, burr hole surgery. Next question. Next question we are having, Rahul has murdered Neha. Rahul ने क्या किया? So let's try to understand. Rahul ने नेहा का मर्डर कर दिया, राइट? स्टैब कर दिया नेहा को, राइट? सो दैट इज द राहुल हैज मर्डर्ड नेहा. नाउ रवि हैज सीन द क्राइम. रवि was going from there and he has seen the crime, right? Now what is happening? And told her wife Priya. रवि ने क्या करा? जाके प्रिया को बताया that I have seen a murder, right? So this is going to be Priya, right? And a doctor is presented to the court of trial to record his evidence. Doctor भी आया है यहाँ पर एक, right? Here the doctor is what kind of witness? So they want to talk about the witness. So we are having different types of witnesses, right? हमारे पास में अलग अलग तरीके के witness होते हैं. Let me make you understand. Just give me a moment. So we are going to have different types of witnesses. One more thing you can remember, जैसे ये case चल रहा है. One more thing. Let's say there is another person is there. Let's say Shubham was there, and Shubham ने क्या किया? Shubham has seen Rahul. तो Shubham is a indirect witness. इसने क्या किया? He saw Rahul with a knife. Let's say he saw Rahul with a knife. Let's try to understand the story. Rahul was going with a knife and he has killed the Neha. नेहा को मारते हुए किसने देखा? रवि ने देखा. रवि has seen the Rahul to kill Neha. And रवि ने जाके किसको बोला? प्रिया को बोला, right? So that is going to be hearsay witness. And who is doctor over here? Who is doctor? So remember, doctor is going to be the expert witness. Doctor is going to be the expert witness. Doctor expert witness है यहाँ पर, right? So what we need to remember, look here. Okay, whenever such case is happening, what are the things the police will do? First of all, someone will inform the police. So कोई ना कोई पुलिस को बताएगा. Now the police will come. And police will inform the magistrate first. Magistrate को ये inform करेंगे and they will be coming to the site. ये पुलिस आएगी site पे, and after coming to the site they will do the inquest. Or you can also call it inquiry. यहाँ पर inquiry officer आएगा and he will be starting the inquest. They will be asking the people the doubt. They will be asking आपने क्या देखा, किसी ने क्या देखा, and they will be asking those people, and these people are known as panchas. And whatever information they will be getting from those people, that is known as panchnama. तो ये पंचनामा बनाएंगे वहाँ पर आकर ऑन द साइट. दे विल बी मेकिंग व्हाट? पंचनामा. एंड ऑन द बेसिस ऑफ पंचनामा हियर दे विल बी आस्किंग, ये बोलेगा कि मैंने देखा एक बंदा आया चाकू लेके एंड ही किल्ड नेहा, राइट? सो दे विल बी मेकिंग द पंचनामा, एंड ऑन द बेसिस पंचनामा इज द प्राइमरी रिपोर्ट, राइट? एंड ऑन द बेसिस ऑफ दैट व्हाट दे आर गोइंग टू डू? दे आर गोइंग टू अरेस्ट द अक्यूज्ड. इनको पता चलेगा and they are going to arrest the accused person. Maybe they can check it out in the CCTV is also evidence, right? So ये arrest करेंगे किसको? Let's say they are arresting the Rahul. They are arresting the Rahul and then they are going to present Rahul to the कोर्ट. अब ये राहुल को क्या करेंगे, कोर्ट में लेके जाएंगे, क्योंकि राहुल ने क्या किया था, नेहा का मर्डर किया था, राइट. सो नाउ व्हाट इज गोइंग टू हैपन, दिस थिंग इज गोइंग टू बी प्रेजेंटेड इन द कोर्ट. नाउ हाउ वी आर हैविंग टू टाइप्स ऑफ केसेस. वी आर हैविंग क्रिमिनल केसेस, वी आर हैविंग सिविल केसेस. सिविल केस अलग होता है, क्रिमिनल अलग होता है. तो इन क्रिमिनल केस व्हाट इज गोइंग टू हैपन, सो क्रिमिनल केस इज गोइंग टू बी बिटवीन द स्टेट एंड द डिफेंडेंट. क्रिमिनल केस, सो इट इज अ क्रिमिनल केस. यहाँ पर क्या होगा, दिस इज गोइंग टू बी फॉट बिटवीन स्टेट एंड डिफेंडेंट. स्टेट का लॉयर होगा, दैट इज गोइंग टू बी नोन एज पब्लिक प्रोसिक्यूटर. स्टेट के लॉयर को क्या बोलेंगे, पब्लिक प्रोसिक्यूटर बोलेंगे. एंड हियर डिफेंडेंट इज गोइंग टू बी, defendant will be having the, defendant is fighting for the accused person, right. And burden of proof किसके ऊपर होगा, remember the burden of proof, किसको ये बात साबित करनी होगी, that is going to be the public prosecutor. public prosecutor को साबित करनी होगी, right. What happens in civil cases, civil case are fought between two parties, so here you will be having one party that is known as plaintiff. पहली पार्टी जो केस करती है, those people who are going to do the case, those people who are filing the case, they are known as plaintiff. And second person who is going to fight against them, right, that is going to be again defendant, right. Civil cases में generally the punishment is going to be monetization. monetary benefits should be, monetary benefits are given, right. ज़्यादा वो नहीं है, right. But in the cases of criminal cases, maximum punishment you can get is life imprisonment, or maybe the death sentence can be given, right. So this is the criminal case we were fighting, and in that particular criminal case what has happened, we are having certain evidences. So what are these evidences, evidence can be a direct evidence, witness can be direct witness, it can be indirect witness. direct witness is the eyewitness, eyewitness को direct witness बोलते हैं. So eyewitness is going to be the, कौन है आई विटनेस यहाँ पर इन दिस पर्टिकुलर केस, द आई विटनेस इज हु, रवि इज द आई विटनेस, राइट. सो हियर द आई विटनेस और डायरेक्ट विटनेस इज गोइंग टू बी द रवि, राइट. हु इज गोइंग टू बी इनडायरेक्ट विटनेस, इनडायरेक्ट विटनेस क्या हुआ, प्रिया कैन बी ए इनडायरेक्ट विटनेस, यस. सो प्रिया इज अ इनडायरेक्ट विटनेस. अपार्ट फ्रॉम दैट शुभम is also a indirect witness. Shubham is also indirect witness. Even the doctor is also indirect witness, right. This Priya is also known as hearsay witness. hearsay, कहा सुना, right. So what Ravi has told, Ravi ने जो देखा वो इसको बोला. So this Priya is become hearsay witness, right. And what about this Shubham, Shubham is also indirect witness, and doctor is also known as expert witness. Expert witness are those witness who are having expertise. Maybe it can be a doctor, maybe it can be a fingerprint expert, right. So all these things are going to be fingerprint expert, that is going to be a expert witness, right. तो यहाँ पर पूछा है कि डॉक्टर क्या होगा, डॉक्टर इज गोइंग टू बी एक्सपर्ट विटनेस. व्हाट इज दिस हॉस्टाइल विटनेस, हॉस्टाइल विटनेस वो होता है जो एंड मोमेंट पे चेंज हो जाए. दिस टाइप ऑफ विटनेस आर नोन एज हॉस्टाइल विटनेस. हियर से यू ऑलरेडी नो, प्रिया इज अ हियर से विटनेस. आई विटनेस यू ऑलरेडी नो, दैट इज गोइंग टू बी रवि. अपार्ट फ्रॉम रवि इफ देर इज एनी CCTV, दैट इज ऑल्सो कंसिडर्ड एज द आई विटनेस. ठीक है, तो समझ में आई बेसिक कहानी क्या है, how we are having these cases, how they are going to be worked, right. Next thing we are having is the leading question. Leading questions are permitted in, leading questions are permitted in. So we can continue the story. So what was happening, हमने क्या किया था, we have taken the Rahul to the court, we have taken the Rahul to the court. Now what we need to do, Rahul क्या करेगा अभी, राहुल को खड़ा कर देंगे, सबको ओथ दिलाएंगे. whatever witnesses are coming, they need to take the oath, okay. And oath, after the oath there will be what, there will be examination of the witness. गवाहों की क्या ली जाएगी, एग्जाम ली जाएगी. वी विल बी रिकॉर्डिंग द स्टेटमेंट्स ऑफ द ऑल द गवाह जो भी आ रहे हैं, जो भी लोग विटनेस है उनके गवाहों के बयान लेंगे, राइट. दैट इज गोइंग टू बी द थिंग. सो वी आर हैविंग चीफ एग्जामिनेशन. चीफ एग्जामिनेशन रिमेंबर इज डन बाय सेम साइड लॉयर. और सेम साइड लॉयर मतलब क्या हो गया, हियर द चीफ एग्जामिनेशन इज डन बाय द पब्लिक प्रोसिक्यूटर. सो फर्स्ट टाइम जब भी कोई भी एविडेंस आएगा, तो फर्स्ट टाइम पब्लिक प्रोसिक्यूटर विल गो एंड ही विल आस्क सम क्वेश्चन. दैट इज व्हाट इज नोन एज चीफ एग्जामिनेशन, राइट. After chief examination, what will happen, the opposite side lawyer will come, and this is known as cross examination. Now the opposite side lawyer will come. and he is going to ask some question. This is known as cross examination. And remember, here this opposite side lawyer can also ask the leading questions. Leading questions matlab they can ask you yes or no questions. Yes or no questions are also permitted. आप वहाँ थे या नहीं थे, that these type of questions they can ask, and this is known as cross examination. So remember, leading questions are or can be asked in the cross examination. And lastly we are having the re-examination. Re-examination में क्या होगा? Again the same side lawyer will come, the public prosecutor, and they are going to ask the question to the same person, right? That is how this court is going to work, right? So this cross examination or leading question can be asked during the cross examination, and here the answer will be in the yes or no. उसके बाद में क्या होगा? After this they will collect all the evidence. They will collect all the evidences which are presented to court of law according to the law. They will collect all the evidences, and then the judge will be passing the judgment. Judge क्या करेगा? Judgment pass करेगा, and now this judgment is going to get executed. अगर जज ने कहा कि this is the accused, now we are having all the proofs, now we are going to give that sentence, or let's say life imprisonment to Rahul. So what is going to happen? He is going to give the judgment, and this judgment needs to get executed, right? So this is how this complete story is going to work. What is this hostile witness? One more thing we can discuss. Hostile witness क्या होता है? These are the witness who can change the statement. So ये वो witness होते हैं who change the statements. ये पैसे खा लेते हैं. These are the people who are changing their statements. So that is going to be the hostile witness, right? And remember, hostile witness, all we can also ask the leading questions. We can also ask the leading questions to the hostile witness. तो leading question के ऊपर question आया हुआ है. So what you need to remember, in the cross examination and in the hostile witness we can ask the leading question. क्या होता है leading question? Yes or no में answer देना है. That is going to be the leading question. I hope you understood this. No issues with this. Moving on to next. Give me a quick confirmation. No issues with this. Okay, moving on to next. Next we are having is what? Next we are having is homicidal smoothing by sitting on the chest is known as what? Homicidal smoothing by sitting on the chest is known as what? Homicidal smoothing. Try to answer. So स्मूथरिंग का मतलब क्या होता है? व्हाट इज स्मूथरिंग एंड व्हाट इज होमिसाइडल? होमिसाइडल मतलब सामने वाले को मारने के लिए, राइट? वेरी गुड, very good. Con medico, that is going to be barking. That is going to be barking. Let's try to understand what are these different methods we are having. Let's try to understand them, right? So smoothing का मतलब क्या होता है? Look here, this person ये क्या कर रहे हैं? तकिया लेके मुंह बंद करने की कोशिश कर रहा है. That is what is smoothing, right? So they are going to put the pressure. That is known as smoothing. लेकिन ये ऊपर नहीं है smoothing. लेकिन ये ऊपर नहीं है. इफ दिस पर्टिकुलर पेशेंट इज सिटिंग ऑन द चेस्ट. सिटिंग ऑन द चेस्ट मतलब लुक हियर, they are closing the mouth, they are closing the nose, along with that they are also sitting on the chest. Sitting on the chest means they are going to put what? They are going to do what? Traumatic asphyxia also. They are going to do traumatic asphyxia. Asphyxia, these are the methods of asphyxia, right? So traumatic asphyxia along with smoothing. Smoothing में क्या करना है? मुंह और नाक बंद करने, राइट? सो इफ दे आर क्लोजिंग द फेस एंड नोज, दैट इज व्हाट इज स्मूथिंग. बट इफ दे आर सिटिंग ऑन द चेस्ट एज वेल, that is both together known as what? Together it is known as barking. Together it is known as barking. This is the image of the barking, right? Smoothing मतलब तकिए से सिर्फ मुंह को बंद कर रहा है, राइट? नेक्स्ट थिंग इज दिस इज योर गैगिंग. अगर मुंह के अंदर कुछ डाल दिया, दैट इज गोइंग टू बी योर गैगिंग. This is going to be your gagging. Okay, this thing, look here. Here, because of some position, this patient is not able to breathe. He is having asphyxia. This is known as positional asphyxia. This is known as positional asphyxia. Or maybe we are having jackknife asphyxia. We are having jackknife position. Jackknife position. We are having jackknife position, right? So these are your positional asphyxias, right? What is this? थप्पड़ मारना कान के ऊपर, दैट इज गोइंग टू बी नोन एज टेलीफोना. टेलीफोन लगाते हो, सो यू कैन रिमेंबर दैट इज गोइंग टू बी टेलीफोना. दिस इज गोइंग टू बी telephona. Okay, these are the methods of torture. If we are beating on the soul is known as phalanga. Beating on the soul is known as phalanga or bastinado. Bastinado. Right, here we are having dry submarine. इसमें क्या होगा, we are using the maybe we can use polythene bag, plastic bags. That is going to be your dry submarine. मुंह को बंद करना है, right? Here we are using some kind of a bag that is going to be dry submarine again. अगर यहाँ पर अगर same place we are using water, we are putting the head into water for asphyxia. What is this known as? Look here, this is known as wet submarine. This is known as wet submarine. If we are using water, this is known as wet submarine, right? This is known as plankton. दोनों हाथ बांध के लटका दिया. This is known as plankton. This is known as plankton. दोनों हाथ पीछे बांध के लटका दिया. That is plankton. This is your parrot perch. You can see the image. This is your parrot perch. Parrot perch, right? This thing is known as, this is looking like a horse. This thing is known as sawhorse. Sawhorse. This thing is known as sawhorse, right? And this is a garroting. यहाँ पर क्या होता है, पीछे से they are going to tighten something, right? And then they are going to rotate this wheel. They are going to rotate this wheel, and what will happen? This person is going to die ultimately. This is known as garroting. Garroting. This thing was in the Spanish part. Okay, garroting. Garroting अभी तो नहीं है. This thing was happening back then, right? So these are the methods that you need to remember. What is this garroting? You can remember garroting is also known as, it is also known as Spanish windlash. Spanish windlash. This is also known as Spanish windlash. अगर किसी का गला दबा रहे हो, if you are just doing the pressure on the neck, that is known as throttling. That is known as throttling. And throttling में कौन सा bruise होता है? We are having 6 penny bruise. Remember, 6 penny bruise. Throttling will produce 6 penny bruise. You will be having markings on the bruisings on the neck. That is going to be 6 penny bruise. Now you know what is mugging, what is bansdola. Bansdola में क्या होता है? Basically, suppose this is your neck. Suppose this is your neck, and here we are going to tighten 2 sticks, right? And they are binded together, and then we are going to press it. Okay, so these are the sticks, और इनका pressure लगाएंगे, and this is going to be your neck. This is known as bansdola. This is known as bansdola. So these are the methods of torture and asphyxia. ये मारने के तरीके. These are the methods, right? Now you know what is smothering. Smothering मतलब the person is sitting on the person is going to block the mouth and nose of the person. That is going to be smothering. Gagging में क्या होगा? कपड़ा ठूस दिया. Positional asphyxia is going to be what? Because of the position, this patient is not able to breathe. Telephona, थप्पड़ मारना, telephona. Phalanga और bastinado मतलब torture on the legs, on the sole. Dry submarine is going to use the paper bag or plastic bags, right? Wet submarine, they are going to use the water. Plankton में दोनों हाथ पीछे और लटका देंगे, right? Parrot perch will be there, and this is going to be sawhorse. You can appreciate the image, you can remember sawhorse will be there. And garroting, also known as Spanish windlass, in this train we are having, इसको rotate करेंगे, right? And bastinado you already understood, right? So this is going to be the thing. So answer in this particular case is going to be answer number A. That is going to be in the favor of Burking. That is going to be in the favor of Burking, right? Next question we are having, a person is thrown in water and died due to drowning. Patient कैसे मर गया? Died due to drowning. But before dying he had made his best efforts. मरने से पहले he has made his best efforts to survive, which led to contraction of a group of muscles, and primary relaxation is going to be absent. There is no primary relaxation. Which phenomena explain this particular thing best? Which phenomena is going to explain this particular thing best? So what will happen in the drowning? Let's try to understand. अगर कोई पानी में डूब रहा है, so we can have two things. We can have antemortem drowning, यानी एंटीमोर्टम मतलब जिंदा इंसान डूब रहा है, एंड वी कैन हैव पोस्टमार्टम. पोस्टमार्टम मतलब नाउ द पेशेंट इज डेड. पोस्टमार्टम ड्राउनिंग मतलब कोई मरा हुआ इंसान, उसको पहले मार दिया, देन वी आर पुटिंग हिम इनटू द वाटर. सो दो चीज़ें हो सकती है, वी कैन इजीली आइडेंटिफाई एंटीमोर्टम यानी पानी में ही मरा है, और पोस्टमॉर्टम मतलब आफ्टर द डेथ दे विल बी थ्रोइंग दिस पर्टिकुलर पेशेंट इन द वाटर, राइट. सो एंटीमोर्टम ड्राउनिंग में क्या होगा, दिस पर्सन इज ट्राइंग टू सर्वाइव, राइट, दिस पर्सन इज ट्राइंग टू सर्वाइव, सो ही विल बी मेकिंग हिज बेस्ट एफर्ट्स, राइट. सो ही विल बी डूइंग व्हाट, क्लेंचिंग ऑफ फिस्ट्स, he will be doing clenching of fist, ये clenching of fist करेगा, and because of that what is going to happen, you will be having accumulation of some dirt, you will be having accumulation of some dirts and plants, and that is what is known as cadaveric spasm, cadaveric spasm. So when you, this person is going to die, you will be finding that उसके हाथ में कुछ ना कुछ dirt होगी, there will be some kind of grass will be there, so that is known as cadaveric spasm, right. What do we call the study of death? Study of death is known as thanatology. Remember, thanatology is the study of death. Thanatology is the study of death, and this is the cadaveric spasm that we are going to have, right. This is the cadaveric spasm that we are going to have, right. So what are these changes? Rigor mortis, albor mortis, liver mortis, right. What are these changes? Let's try to understand. The first one we are going to have is pallor mortis. Pallor mortis. Pallor mortis means what is going to happen here, the skin, pallor means skin is going to become pale, skin is going to become pale after the death of the person. After the death of the person, the skin is going to become pale because there will be no blood supply, right. What is going to be with the algor mortis? What is this algor mortis? Algor mortis matlab body will be cooling down, you will be having what, cool down of the body, so you will be having loss of heat from the body, loss of heat or cooling of body will be there, cooling of body will be there. What is the rate you will be having the cool down of the body? So that is going to be 0.5 degrees Celsius per hour. That is the rate this body is going to get cooled down. In septicemia it will be hot, it will be hot because of the bacterial activity. There are certain things you have to remember, right. But normally it is going to cool down, that is known as algor mortis. What is this livor mortis? Livor mortis. Livor mortis means you will be having certain discoloration after death. Discoloration after death, which is basically explaining the cause also. You can also call it postmortem staining. They can also tell us about the cause, postmortem staining. I'm going to make you understand. We are going to write that down also, right? What is this rigor mortis? Rigor mortis, here you will be having stiffness in the body parts. There will be stiffness after death is known as, the stiffness after death is known as rigor mortis, and here you will be having depletion of ATP stores. Here you will be having depletion of the ATP stores. That is what is known as rigor mortis, right? What other changes you will be having? The postmortem eye changes, you can remember eye changes. So first sign you will be remembering, in the retina you will be having a sign that is known as Kevorkian sign. Kevorkian sign. Kevorkian sign, also known as railway track sign. Kevorkian or railway track sign. Okay, कितनी देर में आएगा Kevorkian or railway track sign? After like within 10 minutes this thing you can find, right. Then what will happen, there will be starting of corneal clouding. Corneal clouding start हो जाएगी, so you will be having corneal clouding within like starting from the 1 hour, it will be going up till 6 hours. You will be having complete corneal clouding, right. You can also have other signs like tachynoir. Tachynoir is going to come within like 3 to 6 hours, right. These are the signs, these are the changes you will be having in the eyes, right. Lastly, what is going to happen after all these changes? You will be having autolysis. Autolysis because of certain bacteria living in your gut, right. You will be having Clostridium perfringens, which is having lecithinase enzyme, and that is going to do what? Putrefaction. Putrefaction, right. So all these things are going to be the changes you will be having, right. So here now we know what is rigor mortis, what is algor mortis, what is livor mortis, antemortem drowning, postmortem drowning, right. Now Try to answer this question. During examination of a patient who had an injury, the hair bulbs are noted to be damaged and crushed. What is this type of injuries? Is it an abrasion that you are looking at? Is it an incision? Is it a laceration? Or is it a stab wound? What do you think is that? What kind of injury is this? Yes, Kajal, Jayant, hi. What kind of injury is this? So let me make you understand how many type of mechanical injuries do we have. Let's try to understand them. So we can have injuries due to blunt forces. We can have injury due to sharp forces and miscellaneous objects. We can have abrasion, we can have contusions, we can have lacerations, we can have fracture, we can have incised wounds, chop wounds, stab wounds, right? These are your firearms, right? So let's try to understand the abrasion first. What is the meaning of abrasion? What is the meaning of abrasion and what is this image is showing? So we are going to have what? Abrasion, or this is your, whatever is given is your grazed abrasion. This is your grazed abrasion. Grazed abrasion, also known as brush border wound. This is also known as gravel rash, also known as brush fire, right? So whenever you are having road traffic accident, you can have this type of lesion that is known as abrasion. That is known as abrasion. Remember, we will be having loss of epidermis here. Here we will be having loss of epidermis will be there. Loss of epidermis will be there, right? This is going to be your patterned abrasion. This is going to be your patterned abrasion. Patterned abrasion, right? Here we are having, we are also calling it imprint abrasion, or sometimes we are also calling it imposed abrasion. ये पैटर्न छप गया यहाँ पर. Can you appreciate this pattern? This is known as patterned abrasion, which will be having the involvement of the epidermis, right? And this is going to be your pressure abrasion. यहाँ पर due to excessive pressure, we are having this thing strength. This is ligature mark when someone is trying to die, right? Or maybe someone is doing the homicide also. Then also we can find this pressure abrasion. Then we can find this pressure abrasion, right? After abrasion, the second thing we are going to have is what? Look here. Second thing we are going to have is what? Contusion. So now we are going to discuss about the contusion. Contusion will be having what? Bruising will be there. There will be involvement of the blood vessel. Remember, in contusion, you will be having blood vessel involvement. Blood vessel injuries will be there. Like this is your easy bruising that we are having. Bruising is there, right? And whenever we are having this particular thing, this is known as migratory bruise, or you can also call it migratory ectopic bruising is there. Ectopic means the lesion is not here. The lesion, the problem is not in near the eyes. This is ectopic bruising. Ectopic matlab problem kahin ho rahi. This is not the original site. The problem lies in the fracture of the middle cranial fossa. MCP fracture is there. MCP fracture is there, and this particular sign is known as raccoon sign, raccoon eye, or battle sign. We can also remember the battle sign, raccoon eye or battle sign. These are the migratory bruise that you have to remember, right? Ectopic and migratory bruise. We can also remember the 6 penny bruise due to throttling that was happening, right? So these are the bruising which will be involving the blood vessels. Last thing we are having is the lacerations. Lacerations will be involving all the things. So we are going to have, this is your laceration. This is your laceration, right? So what is going to happen in the laceration? You will be having tear or cut in the skin. You can have tear or cut in the skin, and that is what is going to produce the, that is what is going to involve the hair cells also, right? So that is going to be the laceration, and this particular thing is known as degloving injury. Degloving injury, or also known as avulsion. Avulsion or degloving injury, that was the question they have asked you, right? And this type of tailing, if you find, this is an incised wound. This is an incised wound. Incised wound, right? And next thing, if we are stabbing someone, this is going to be a stab wound. This is going to be a stab wound. Generally we are going to go, it will be having more depth inside, it will be having more depth, but this one will be more superficial, and here you will be finding this fish tailing. here you will be finding this fish tailing. Fish tailing is a feature of incised wound, whereas this deep wound will be having stab. This is going to be your stab wound. After this, we are going to discuss about the fractures. So we are going to have these fractures. First fracture that we are having is going to be a linear fracture. Remember, look here, this is a linear fracture. This is a linear fracture. We are also calling it fissured fracture. We are also calling it fissured fracture. This is your linear fracture or fissured fracture. This particular thing is known as Pond's fracture. यहाँ depression है. This is your Pond's fracture, generally seen in the infants. Generally seen in the infants. This is known as Pond's fracture. What is happening here? Here you are finding this depression. Depression is there. This is known as signature fracture. There will be fracture of the ala. That is going to be the signature fracture. Okay. This type of fracture is known as the head is divided into two halves, right? This type of fracture is known as motorcyclist fracture. Motorcyclist fracture, also known as hinge fracture. यहाँ क्या होगा? The head will be divided into two parts, which from the middle part, that is going to be the motorcyclist fracture. And this one, the ring is involved. This is known as the ring fracture. A ring fracture. This is known as ring fracture, right? So these are the fractures we are having. These are the abrasions we are having, right? Abrasions, lacerations, contusion. These are the things we are having. So here in this particular case, the answer will be laceration. This is going to be a lacerated wound because it is involving all the things, right? So that is going to be the lacerated wound. Now about the shots, we are having a circular bullet wound was there. Erythema is seen around the margin. So now next thing, we are having the bullet injuries. So circular bullet wound is there. How we are going to assess? The shot is fired from which distance, right? So erythema is there around the margin. Blackening is there. Kala kala ho rakha hai. Tattooing is there. Okay. And identify the range. We need to identify the range. So by looking at the lesion, can we identify the range? Yes, we need to look for three things. What are these three things? First thing is going to be singeing. Singeing, or also known as burning. Burning or singeing is because of the flame. ये राइफल से गोली निकलेगी and it will be causing this particular thing. तो अगर singeing or burning present है, that is because of flame. Second thing, we are having blackening. Blackening is because of what? It is because of smoke. Blackening is because of the smoke. And third thing we are having is the tattooing. Tattooing is because of what? Tattooing is because of the gunpowder. So whatever gunpowder we are using, that is going to produce what? Tattooing. Three things you have to remember. One is singeing, second is blackening, third is tattooing. SBT you have to remember, right? If you remember this, we can easily identify the distance. So this is going to be the rifle which is going to shot, right? Now what is going to happen? If the lesion, if the shot is done from a contact, what will be there? You will be having satellite margin. You will be having satellite margin will be there. Sorry, not satellite. You will be having stellate margin. Stellate margin will be there. Like a crucifixion will be there, right? This type of margin you will be finding, okay, whenever you are shooting from a contact, from the contact. Second thing, you will be having singeing because it is from the contact. It is from the contact. If I'm shooting here, what will happen? Because of the flame, what will happen? There will be burning, right? So singeing will be present or burning will be present. Blackening will be there. Blackening will be present, and tattooing is also going to be present. Tattooing is also going to be present. So all these three things are going to be present. If all these three things are present, okay, but they are not outside. Remember, they are going to be inside the tissue. Inside the tissue you will be finding all these things. That is going to be suggestive of a contact wound. That is going to be suggestive of a contact wound, right? Next thing, if we are shooting from a close range, remember here we are going to have presence of all these three. SBT will be present. SBT will be present, and the lesion will be circular. Lesion will be circular all over there, lesion will be circular in all other cases. If the lesion is given stellate, that is going to be the contact wound. अगर circular दे रखा है तो इन तीनों में से कुछ होगा. What are the three other things we are having? Either we can have close shot, either we can have near shot, either we can have distant shot, right? तो अगर close shot होगा तो SBT तीनों present होंगे. Maybe S can be absent, but BT is going to be present, right? Apart from that, you will be having what? Erythema. You will be having this erythema. Can you appreciate this erythema is there, right? This erythema is there. ये चारों तरफ थोड़ा थोड़ा red है. That is going to be erythema. Whereas this in near shot, you will be having only and only tattooing is going to be present. Tattooing is going to be present, and remember this erythema is going to be absent. There is no erythema, so you can easily identify अगर erythema नहीं है और tattooing present है, if only the tattooing is present. And why this tattooing is happening, we have discussed. It is because of gunpowder. Tattooing is because of gunpowder. So अगर tattooing दिख रहा है सिर्फ, so that is going to be a near shot. Okay, and if nothing is there, SBT is going to be absent. That is going to be a distant shot. That is going to be a distant shot. Okay, so what are the things you need to remember? अगर SBT दिख रहा है, stellate margin है, that is going to be contact shot, यानी बिल्कुल पास से मारा, बिल्कुल टच करके मारा, right? Close range is going to show you what SBT can be present, erythema will be there, that is going to be close range. Near shot will be having what? Only tattooing is going to be present, and distance will not even have tattooing, right? Even if you remember this, you will be able to solve the answer. Now you will be telling me what is going to be the answer here. Is it going to be a contact? Contact may remember what I've told you. There will be SBT is going to be present, right? Close shot, SBT is going to be present. Near shot, only T is going to be present. Sometimes here we are all only having BT, and distant shot, nothing is going to be present, everything will be absent, right? Apart from that, in the question they have given the circular bullet wound is there, erythema is there. If erythema is given, what is going to be your answer here? Erythema is given, erythema is going to show in the close wound, right? So this is going to be the close shot. I hope you will be making this type of questions correct, right? You cannot make this type of questions wrong. Easy questions, right? What is fear of height is known as? What is fear of height is known as? Fear of extremities, fear of height is known as what, beta? That is going to be your acrophobia. Fear of height is known as what? Acrophobia. What is this mesophobia? Mesophobia is the fear of contamination. Fear of contamination. Fear of contamination is known as what? Mesophobia. Nyctophobia is what? Fear of darkness. Fear of darkness is known as what? Nyctophobia. Okay, and what is this agoraphobia? Agoraphobia is going to be fear of open or close. It can be open space, it can be closed space where escape is difficult. Space where escape is difficult. It can be an open place, it can be a closed place. Open मतलब बहुत बड़ा ground है, right? Escape is difficult. That is known as agoraphobia, right? What is claustrophobia? Claustrophobia. Now this is going to be the fear of, yes Kajal, that is going to be Andhera. So this is going to be fear of closed spaces. Closed spaces. That is going to be fear of closed spaces. Nyctophobia, fear of darkness will be there. Okay. For the fear, all these fears, what kind of therapies we are giving? In psychiatry, what kind of therapies are giving? For the phobias, we are going to give behavioral therapies. Behavioral therapies we are going to give, right? Now, next question we are having. A 43-year-old patient is presented to emergency with some kind of poisoning. This patient has some kind of poisoning. The color of the skin has turned into greenish color. Okay, and smell is coming like a rotten egg. सड़े हुए अंडे जैसे smell आ रही है. What is going to be the possible diagnosis in this particular case? What poisoning this patient has, right? This person has which kind of poisoning? So let me make you write all these postmortem changes. These are the lividities. I have told you postmortem changes, right? So some changes and their smells, right? So we are going to have this lividity, right? And what are these? First of all, let's talk about the carbon monoxide. Carbon monoxide is going to give you cherry red color. So the patient will be having cherry red color if the poisoning is because of carbon monoxide. Remember, the treatment of carbon monoxide is going to be oxygen, right? If person had a cyanide poisoning is going to give you brick red color. Brick red, just like your ईंटों के जैसा कलर होता है, ईंट जैसा कलर, that is going to be the cyanide poisoning. If the patient is dying because of hypothermia, it is going to give you pink color. It is going to give you which color? That is going to give you pink color, right? Next we are having potassium chlorate. If the person is dying because of potassium chlorate, it is going to give you brown color, or let's say chocolate brown color. Chocolate brown color will be there. If the person is dying because of aniline is going to give you deep blue color. Aniline is going to give you which color? Deep blue color, right? If the person is dying because of sepsis or septic, let's say septic abortion is there. Septic abortion is going to give you color of bronze like skin will be there. And why this thing is happening? Because we are having what? Clostridium perfringens, right? This Clostridium perfringens is going to do that. If the patient is dying because of hydrogen sulfide, our question, you will be having bluish green or greenish color. Bluish green or greenish color will be there. Hydrogen sulfide, bluish or greenish color will be there, right? And if the person is dying because of opium or opioid toxicity, you will be having black color. So in this question, what is the color? Greenish color. What can be the answer? That is going to be your hydrogen sulfide. Is going to be the answer, right? What about the smell? They have given you rotten egg. सड़े हुए अंडे जैसी smell आ रही है, right? So let's write some smells also. So these are the smells. They are going to help you solve a lot of questions, right? They are asking in FMT, they are asking approximately 10 questions. 1-2 question they are asking from this, right? So that is going to be, if the smell is acrid. If they have written in the question, these are the keywords. Acrid smell, that is going to be in the favor of aldehyde. सड़ी हुए मछली जैसी, rotten fish, that is going to be aniline. Deep blue sea, rotten fish. Deep blue sea, remember, deep blue sea will be having what? Rotten fish, aniline, right? Next, kerosene like smell you will be finding in the organophosphate poisoning. Any organophosphate poisoning can be there, right? Kerosene like smell. Fishy or musty, that is going to be zinc phosphide, ZNP. That is going to be zinc phosphide, right? Next, bitter almond, that is going to be cyanide poisoning. Cyanide poisoning will be having what? Bitter almond, right? Burnt rope, jali हुई रस्सी, that is seen with the cannabis or ganja, right? Garlicky is important. Multiple times they have asked you, right? So you can remember TAP, T for thallium, A for arsenic, and P for phosphorus. So you will be having these three things will be having what? Garlicky smells, right? And if the person is having alcohol toxicity, you can remember alcohol is going to show you fruity smell. Fruity or sweet smell will be there. So this is the table you can see just before your examination. Tomorrow you can give the exam if you remember this, right? So that is going to be the thing, right? So in this particular question, they have given you rotten eggs and greenish smell. These are the two keywords. If you pick up these two keywords, definitely you will reach into your answer. That is going to be your hydrogen sulfide, right? Bluish greenish, right? Next question. Now we do not have IPCs now these IPCs has changed to BNS. अभी पहले IPC होता था, now we have changed it to BNS. What is this BNS? भारतीय, this is going to be भारतीय न्याय संहिता. Okay, this has come in action from 2023. Earlier we used to call Indian Penal Code, IPCs were there. Now we are having BNS, Bharatiya Nyaya Samhita, right? Instead of CRPC, Criminal Procedure Code, we have, instead of CRPC we are having BNSS, that is Bharatiya Nagrik Suraksha Sanhita. That is going to be Bharatiya Nagrik Suraksha Sanhita, right? And earlier we used to have Indian Evidence Act, right? Now we are having BSA, Bharatiya Sakshya Adhiniyam, Bharatiya Sakshya Adhiniyam, Bharatiya Sakshya Adhiniyam, right? So that these are the things with, these are certain changes that you have to remember, right? Earlier we used to have this thing, right? So what does this particular question is saying? A 27-year-old female is coming to you. 27-year-old female is died. This particular person is died after 5 years of her marriage. She left a video, एक वीडियो उसने छोड़ा है, एंड द वीडियो इज स्टेटिंग दैट शी वॉज टॉर्चर्ड फॉर ड्राउरी. उससे पैसे मांगते थे उसके घर वाले और पति आफ्टर द मैरिज, राइट? उसने वीडियो में एविडेंस दिया है, राइट? एंड शी स्टार्ट नाउ द केस हैज स्टार्टेड. कौन सी BNS लगेगी उसके ऊपर? अर्लियर वी यूज्ड टू टॉक अबाउट IPCs, नाउ वी विल बी टॉकिंग अबाउट द BNS. सो यहाँ पर डायग्नोसिस क्या हो गया? व्हाट इज द प्रॉब्लम वी आर हैविंग ओवर हियर? दिस इज द केस ऑफ ड्राउरी डेथ. दिस इज द केस ऑफ ड्राउरी डेथ, राइट? ड्राउरी डेथ के लिए कट ऑफ क्या है इंडिया में? द कट ऑफ इज गोइंग टू बी, अगर कोई भी फीमेल विद इन 7 years ऑफ मैरिज, इफ समवन इज डाइंग विद इन 7 years ऑफ मैरिज, so we can have this dowry case, we can have this dowry case. Dowry मतलब दहेज वाला केस लग सकता है. and earlier the IPC was 304B, 304B, right? 304B थी, and now it has changed to what? Now we are having BNS, and the BNS which is going to be for the dowry, that is going to be 80. that you have to remember. This is going to be the BNS number 80. BNS number 80 is for the dowry death. Dowry death is a different thing and the case is a different thing, right? There's agar someone is dying, if someone is dying, then there will be different type, then there will be different section. Otherwise, if someone is not dying, then there will be different section, right? So let's try to jot down all the important things. We are having certain changes, right? So sare updates we are going to write it here, right? So we are having, earlier we used to have 84 matlab that is the McNaughton's rules. That is the McNaughton's rules. So अगर कोई इंसान, if someone is having what? Someone is having schizophrenia, maybe it can be paranoid schizophrenia. So this person when he is in the lucid interval, मतलब जब वो person unconsciousness में है या फिर उस person को नहीं पता, and if he is committing some crime like उसने murder कर दिया, then also this person is not liable for the punishment, उसको सजा नहीं मिलेगी. So that is going to be the McNaughton's rules. McNaughton's rule पहले याद करते थे हाफ माइंड, 4 8 का आधा 4. नाउ व्हाट वी नीड टू रिमेंबर, दैट इज गोइंग टू बी double 2, that is going to be double 2, that is going to be double 2 BNS, right? Next we are having, earlier we used to have 85 for the forced intoxication. किसी ने ज़बरदस्ती ड्रिंक करा दिया, कोई ड्रग्स दे दिए, that is known as forced intoxication. Now we are having 23 IPC BNS for that. 86 is going to be for the self intoxication, खुद ने ले लिया कोई भी thing, that is going to be 86. Now it is going to be 24. Now it is going to be 24 BNS, right? For perjury we had 191 for perjury. Now we are having what? 227 perjury. Now we are having what? 227, right? 193 is going to be the punishment, earlier punishment for perjury. Now we are going to have 229 for that. 229, दो आगे कर दिया, right? So now we are having 229 for that, right? Next thing, earlier we used to have for like grievous hurt, that is going to be 320. Now they have changed it into 116, right? For abortion we are having like 3122, 316, 312 से 316 are for the abortions. These are important ones. So these are for the abortions. Mother is pregnant, mother not pregnant, right? These are for the abortions. Now we have changed. Now we are having what? Now we are having 88 to 92. It will be same, the sequence will be same, but the number has changed, right? So it will be for the 88 to 92, right? Earlier we used to have definition of rape. Definition of rape, we used to have what, 375 or 376 for the punishment. Punishment of rape. IPCs will be having definitions plus punishment different. Here also same. So 63 is for the definition now, and 64 is going to be the punishment. 64 BNS is going to be responsible for the punishment, right? For sexual harassment, you can remember, for like sexual harassment, that is going to be 75. If you are watching someone, right, that is going to be like voyeurism or scatophilia, peeping tom. So for peeping tom, now that is going to be साथ that is going to be 77, right? किसी का पीछा कर रहे हो, if you are stalking someone, that is going to be 78. 78 is going to be for the stalking someone. And dowry death, we have discussed dowry death within 7 years, that is going to be 80. Okay. And if someone is harassing for the dowry, that is known as dowry harassment. For harassment we are going to have what? Harassment we are going to have 85. For harassment we are going to have 85 RBC, BNS, sorry, 85 BNS is going to be for the harassment, right? Next we are having medical negligence. Earlier it was like 304A, negligence. Now we are having, if someone is dying, then it will be 106. It will be 106, right? So these BNS are important, right? Apart from that, some CRPCs like police inquest or magistrate inquest are important. So let's write some BNSs also. So what are the BNSs? Bharatiya Nyay Suraksha Samhita. What you need to remember, earlier it was 194 for the police inquest. CRPC are the procedure codes. BNSS is the procedures, right? So 194 inquest is a procedure. It is not the punishment or definition. It is going to be the procedure. Now it is converted into 174, and earlier it was 196 for the magistrate inquest. Magistrate कब करेगा inquest? When the police failed, right? So in certain cases like exhumation, in certain cases like police custodial death, someone is dying in the police custody, then the magistrate will do the inquest. Inquiry कौन करेगा? Magistrate करेगा. Now it has become 176. Even in the dowry cases, in the dowry death cases, magistrate inquiry is there, right? Earlier, next thing is going to be BSA, that is going to be earlier Indian Evidence Act. Okay, so here two things you have to remember. One is going to be dying declaration. What is the BSA? That is going to be 26 for dying declaration. Dying declaration मतलब मरने से पहले जो भी बोल रहा है, that is going to be DD, right? And for the expert witness, this is also, you can remember, expert witness is going to be 36, oh sorry, 39, not 36, that is going to be 39. So these are the important ones that you should be remembering. BSA, these things are important. BNS, BSA and BNSs, these are the recent advancement, right? So 85 we are going to use for what? 85 किसके लिए हो गया? अगर कोई harass कर रहा है, in the dowry case, if harassment is there, अगर patient मर गई, then there will be section number 80 will be working, right? So next question we are having is, identify the types of substance abuse method given in the image below. So what is that? What these people are doing? They are doing what? Is it begging, snorting, or sniffing, or huffing, or sniffing, right? So what is it? Try to answer. When they are trying to inhale something, they are using what? they are trying to inhale something, right? They are trying to inhale the fumes, inhaling the fumes from the from fumes of a substance from a bag, from a bag. This is known as what? This is known as bagging. Bagging, अगर bag का use ले रहे हैं, that is known as bagging. What are the other methods we are having? Look here. So what this person is doing, he is doing what? ये क्या कर रहा है? He is taking the cocaine. He is taking the cocaine, and this process is known as snorting. This is known as snorting, right? Snorting what? Cocaine. Okay. What she is doing? She is doing huffing. She is doing what? Huffing. Huffing में क्या होगा? Substance will be soaked in rug. The substance will be soaked in rug. Like those people in India, like must have seen certain people, like they will be using what's sulochen, right? What they are doing, they are putting it inside, and then they are throwing the air, and then they are taking it back, right? That is going to be huffing, right? One more thing we are having mainlining. Mainlining किसको बोलते हैं? When we are taking the injections, when the person is taking the injection into IV lines, that is known as IV lines. When the person is taking the drugs through IV lines, that is known as mainlining, right? This is known as skin popping. This is known as skin popping. ये skin के अंदर tags बन रहे, this is known as skin popping, right? And here she will be burning that up, and she will be inhaling the fumes. This is known as chasing the dragon. Chasing the dragon. She will be inhaling the fumes by burning the substance. This is known as chasing the dragon, right? So in this particular case, the answer will be bagging. These people are using the bags, right? Next question we are having: a 53-year-old alcoholic patient is presented to emergency with the symptoms of patient is having what? Confusion, ophthalmoplegia, and difficulty in walking. Difficulty in walking. Which of the following best explains this? What is this particular syndrome we are having? So is it a alcohol withdrawal? Is it a Wernicke's encephalopathy, or Korsakoff psychosis, or alcohol toxicity? So what will happen in alcohol withdrawal? That is going to be different, but what is written over here? Confusion is there, ophthalmoplegia is there, and maybe difficulty in walking can be considered as the ataxia, right? So here you will be having deficiency of, in Wernicke encephalopathy, you will be having deficiency of vitamin B1 because the person is constantly drinking alcohol. Now this person is having the deficiency of vitamin B1, and this is going to present with this symptoms, that is going to be GOA. GOA means what? Global confusion. So this is going to be the triad for encephalopathy, that is going to be global confusion. O for ophthalmoplegia will be there. Ophthalmoplegia will be there. And A for ataxia will be there. So this is going to be in the favor of Wernicke's encephalopathy, and the treatment will be you should be supplementing the vitamin B1 to this particular patient, right? For alcohol toxicity, what is going to be the drug of choice? We have already discussed, that is going to be fomepizole. Fomepizole. Clinically we don't have this particular drug, but for the examination purpose you should be remembering this is very less available, right? So we can use different measures. We are having other things also. What happens in this Korsakoff psychosis? Let's try to understand. It is going to be a late manifestation. Korsakoff psychosis is going to be, it is going to be a delayed neurological manifestation. It is going to be a delayed neurological disorder, right? Which is going to be characterized by CAP, which is going to be characterized by CAP. C is going to be confabulation. What is this confabulation? This person is drinking so much that he started making false stories. He will be making false stories, and he will believe on those stories like they are true. He don't know. He will be telling you that मैं वहाँ से निकला, उसके बाद में मैं कहाँ गया, कहाँ नहीं गया. He will be telling you all the stories, and he also believes that these stories are true, but they are false stories, right? उसको कुछ याद नहीं रहता. He will be having A for amnesia. There will be, he won't be able to remember. And P for, you will be having polyneuropathy, right? So these are going to be the for the Korsakoff psychosis. What about this alcohol withdrawal? Let's try to understand what are the symptoms you will be getting with the alcohol withdrawal. So first of all, within 6 hours you will be getting what? Tremors. If you are not drinking, if you are a constant drinker and stopping alcohol for 6 hours, you will be having tremors. 12 to 24 hours you will be having appearance of hallucinations. Hallucinations will be coming. Hallucinations you will be having 12 to 24 hours. 24 to 48 hours, within 2 days you will be having these seizures. You will be having development of seizures will be there. And then you will be having what? Delirium tremens. You will be having 48 to 72 hours, within 3 days you will be having what? Delirium tremors, right? How you are going to treat this particular thing? You need to give what? For alcohol withdrawal, if you want to quit alcohol, you need to take what? Benzodiazepines. More specifically, if I talk, you need to take chlordiazepoxide, and this is also not very commonly available, so we can use other benzodiazepines as well. But do not directly quit this like alcohol. You need to cut it down slowly, right? Your body is dependent, if dependence is there, right? So that is going to be the alcohol withdrawal time. They are asking constantly questions. If tremor within 6 hours, 12 to 24 hours is going to be responsible for the hallucination. Seizures you will be having within 1 to 2 days, and within 2 to 3 days you will be having what? Delirium tremens, which is a complication that is important, right? So this is how you will be understanding about the alcohol withdrawal, right? So this is going to be what? This is going to be Wernicke's encephalopathy is going to be the treatment in this answer in this particular case, right? The police, next question, the police has arrested a person due to suspicion of some criminal activities. This person is having some criminal activities and the police has arrested him. The person is dead in the police custody. अगर कोई police custody में मारा जाता है, now you know who is going to do the inquest in this particular case, because police ने तो already पकड़ा था और वो मर गया, right? So whenever you are going to have custodial deaths, whenever you are going to have custodial death, whenever you are going to have dowry death और एक्सह्यूमेशन केसेस. एक्सह्यूमेशन मतलब किसी की बॉडी को बाहर निकालना वापस. डिगिंग आउट समवन, दैट इज गोइंग टू बी एक्सह्यूमेशन. सो इन दीज केसेस हु विल बी रेस्पॉन्सिबल फॉर द इंक्वेस्ट? दैट इज गोइंग टू बी मजिस्ट्रेट. Now the magistrate will do the inquiry. So magistrate will be the correct answer. Police is not going to do the inquiry, and not even IB, intelligence bureau, not even doctor, right? So here in this particular case, police is going to do the inquest, right? What is the right time for exhumation? What is the right time? This is your previous year question. When do you do the exhumation? कब जाके खोदा खोदी शुरू करोगे, right? When you will be digging out someone. Exhumation means digging out someone, digging someone out, okay? It should be done under magistrate inquest. You need to have permission from the magistrate. ऐसा नहीं है किसी को जाके ऐसे ही खोदना स्टार्ट कर दिया, right? So you need to identify, you need to take the permission, right? And then this particular thing is going to happen under which CRPC? That is going to be 196 CRPC, criminal procedure. It is a procedure, right? And remember, they have asked you, one option was there. So here there is no time limit. No time limit for exhumation. नो टाइम लिमिट फॉर एक्सह्यूमेशन. यानी अगर कोई 50 साल पहले भी किसी को दफनाया था, नाउ वी कैन ऑल्सो डू द एक्सह्यूमेशन फॉर दैट पर्टिकुलर पर्सन. देर इज़ नो टाइम लिमिट इन इंडिया. एंड राइट, एंड रिमेंबर, वी शुड बी डूइंग दिस थिंग अर्ली इन द मॉर्निंग. रात को भूत आते हैं, राइट? सो वी नीड टू डू इट अर्ली इन द मॉर्निंग. लेट नाइट वी कैन नॉट डू. आफ्टरनून, मे बी देर कैन बी इवनिंग, राइट? सो यू शुड स्टार्ट अर्ली इन द मॉर्निंग. दैट वॉज द right time to do this, right? Okay, so you understand this. With this thing, I think we are done with the most of the important things that that can be asked from this forensic medicine and toxicology. The final quote that we are having here is, stop doubting yourself, work hard, make it happen. I know tomorrow is going to be the exam, and I know most of you have worked really hard for this particular moment, right? Make sure you will stay focused, make sure you will stay calm, okay? Hydrate yourself, do continuous breathing, okay? Just make sure you breathe in between the breaks. Don't change your answer. These are certain points that you have to remember. So these are certain things. If you remember in your examination, don't talk with anyone. These are the points you need to remember. If you remember these things, everything will be fine. You will pass out, you will come out with the flying colors, and definitely everything is going to go in your favor, right? With this thing, we are done with the subject also, forensic. And if you are having any doubts, you can always ask to me, and I will be available. If you are having any difficulties in sleeping as well, right? If you are having anxieties, any issues, you can always reach out to me. I will be available here. Okay, make sure you will sleep early, wake up early, go to the examination hall, don't forget your documents, and just try to give the examination with complete focus. My blessings, your family and God's blessing, everything is along with you, so everything is going to be good for you, right? So with this thing, we are done with this. Thank you so much for all your patience, and keep learning, guys, keep learning. Okay, thank you. बिल्कुल फोड़ के आना है, बिल्कुल फोड़ के आना है. एंड make sure you will not change your answers. One more thing, make sure you will not change your answer change करने से क्या होता है ना, the ultimate thing is कि पेपर तो मतलब कुछ भी होगा, रिजल्ट तो कुछ भी आएगा, बट व्हेन यू चेंज योर आंसर, व्हाट विल हैपन, यू विल हैव दैट एंजाइटी, समथिंग इन योर माइंड कि हाँ यार कुछ चेंज कर दिया था इसलिए एक नंबर कम आया. तो मेक श्योर ऐसी मिस्टेक्स हम लोग करेंगे ही नहीं है. हम लोग एक बार में पेपर करेंगे. यू कैन चेक मल्टीपल थिंग्स ओवर देयर. जाने के बाद में, like let me those people who are having exam, let me give you the strategy how you are going to give the exam. It will take 5 more minutes. So when you are going to go to the examination hall, how many of you are having exam tomorrow, right? So when you are going to go to the examination hall tomorrow, what you need to do, first of all, check for your documents. Whatever documents you are having, like just take your admit card printed, take your passport, and maybe your Aadhaar card, whatever you are having, or keep both, right? Just take your documents, go to the examination hall early as possible, right? Don't be late, go early. When you go inside, when you do the frisking, what is going to happen, you will be having time with you, right? So you will be sitting in front of your screen. When you are sitting in front of your screen, you can do one thing. First thing, you can decrease the brightness of the screen according to yourself. There will be monitor, there will be button, you can change that. Okay, before starting the paper, after paper starting, don't do anything, right? So before the starting of the paper, you can do these things, because sometimes you know there will be more straining. The computers are old, so you can have more straining on eyes, you will get tired, right? Make sure you will urinate, you will hydrate yourself well. And when you are sitting, just try to do the deep breathing, just try to do the deep breathing. Don't talk with your neighbors, just try to do the deep breathing. Once the paper will start, you will be having the adrenaline rush you will be having. So starting 10 question, I am allowing you, you can change your answer, right? Because you will be having adrenaline rush, you can change your answer for starting 10 questions. Apart from that, you should not change any answer. उसके अलावा कुछ भी चेंज नहीं करना है, nothing you have to change, right? Second thing, the papers, I think you should be giving the paper in a single go. देखो, अभी जो आता है वो बाद में भी आएगा, अभी नहीं आता वो बाद में भी नहीं आएगा. तो you should be thinking and you should be giving the paper in a single go. Always anticipate that 10 to 20 questions will be difficult. ऐसा मान के चलना है कि अगर आने वाले 10 questions difficult होने वाले हैं. So that is going to, अगर question आसान आ गया, you will be happy. अगर tough आ गया, you are already anticipating that, right? So that is going to make your mind clear, right? Then what you need to do, you need to breathe in between, you need to take certain breaks, and you need to breathe in between. जब भी लगे थक रहे हो, नींद आ रही है, थकान हो रही है, you can take a break and you can breathe in between, right? कोई दिक्कत नहीं आएगी. नेक्स्ट थिंग, व्हाट यू नीड टू डू, हाइड्रेट योर सेल्फ. पानी वानी सब पहले ही पी के रखना है, राइट? नेक्स्ट थिंग, डोंट चेंज योर आंसर. दीज आर द थिंग्स यू शुड बी टेकिंग केयर. जैसे ही पेपर हो जाए, उसके बाद में डू नॉट टॉक अबाउट पेपर. Do not talk about paper. There will be break. In that break, you have to have lunch. You need to have, maybe you are eating fruits, maybe you are taking caffeine or coffee, but make sure you will take at least 30 minutes of rest, because neurotransmitters are limited. Okay, they will be getting exhausted, तो थोड़ा टाइम के लिए रेस्ट लेना है. And then again you should be going early, and paper 2 will start. बीच में तुम लोग रिवाइज कर रहे हो, तो make sure you will be revising the paper 2 subjects like obscuring, images, stagings, you can see. surgery you can see, right? And then you will be appearing for the paper 2. पेपर 2 में जाने से पहले सिर्फ ये याद रखना है, पेपर 1 हो गया, अच्छा हुआ बुरा हुआ किसी को नहीं बताना, अल्टीमेट थिंग रिजल्ट सबका आएगा, राइट? सो मेक श्योर बहुत अच्छा हो गया, बहुत बुरा हो गया, ज़्यादा खुश नहीं होना, ज़्यादा दुखी नहीं होना, मोडेस्ट रहना है, एनीथिंग कैन हैपन, 50% ऑफ द पेपर इज लेफ्ट, इवन इफ यू just do paper 2 well, then also you will get pass, even if you do paper 1 well, then also you will get pass, है ना? 50% चाहिए अपन को, आधा पेपर भी अगर आता है तो अपन पास हो जाएंगे। बी पॉजिटिव, ठीक है, खुद को पॉजिटिव बोलना है, पॉजिटिव सोच रहे हैं। इफ़ यू आर सिटिंग इन द एग्जाम, 10 क्वेश्चन ऐसे आ रहे हैं जो बिल्कुल हवा नहीं लग रही, पता नहीं चल रहा है, जस्ट रीज अ लिटिल, लुक अराउंड, सी द पीपल, यू हैव डन योर हार्ड वर्क, दोज पीपल ऑल्सो हैव डन देयर हार्ड वर्क, ठीक है? तुमने नहीं पढ़ा मतलब किसी को नहीं आता, सिंपल अंडरस्टैंडिंग रखो, तुम्हारे नोट्स में नहीं है, तुमने नहीं पढ़ा, तुम्हें नहीं आ रहा, दैट मीन्स किसी को नहीं आ रहा, डोंट गेट पैनिक, जस्ट लुक अराउंड एंड यू विल बी इन अ काम सिचुएशन, ठीक है? किसी से बात नहीं करनी, एंड दिस इज हाउ यू आर गोइंग टू गिव द पेपर, राइट? पेपर 2 देने के बाद में तो फिर रिकॉल करने आ ही जाओगे, राइट? सो दिस इज हाउ यू नीड टू डू द पेपर, बी पॉजिटिव, मेक श्योर you will tell yourself positive affirmations, okay? Remember, like, this is the last phase of your preparation, last 6 months you have been continuously studying, right? And now when you are going to give the exam, make sure you will pass it, right? So ये तुम्हारे हाथ में नहीं है, दिस थिंग इज नॉट इन योर हैंड, यू जस्ट नीड टू गिव योर 100%, अगर अपन ने 100% दिया है, नाउ रेस्ट थिंग इज अपॉन द गॉड और वट एवर यू हैव, राइट? सो बाकी चीज़ें सब ऊपर वाले के ऊपर छोड़ दो, किस्मत के ऊपर छोड़ दो, वॉट यू हैव इन योर हैंड इज द मेहनत, राइट? You have done your 100% hard work, now everything will be fall into its place automatically, you need not to worry about it, and definitely you will pass your exam, right? So with this thing I take your bid, and tomorrow maybe we will be meeting, and that is how you will be giving the exam. You can give the reviews, you can connect with me on my Instagram and Telegram, right? So thank you so much for all your patience, and see you later guys, okay?